Hello, everybody. Welcome back to the Assembly of First Nations virtual gathering on Jordan's Principle, First Nations Innovation and Determination. My name is Matthew Castane. I'll be your facilitator for today. Actually, I've been your facilitator now for 2 days. This is going to be our third day together. I just wanted to go a little bit over what we've heard so far and then set you up for our day today. And then a couple of announcements, and then we'll bring our first panel. We'll start our agenda. So far, it's been a very informative session. So we started day one. We started with some opening remarks from the regional chief. We had an update on the Human Rights Tribunal. We did get Stuart and David and Sarah, who are legal counsel for the First Nations Caring Society and also the Assembly of First Nations, to give us a little update on what's happening with the Human Rights Tribunal. We also heard from Valerie Gideon and Julian Castane, who will join us today, a little bit about the operational implementation updates in terms of what was happening within the department. And that was our first day, and which was I think our participants were just getting warmed up. But day two was definitely a little more busy with our participants sending in the questions, a little more interactive. So we did have part one in terms of innovation with Jordan's Principle, care and service models. We did have Manitoba, Nova Scotia, and also Julien giving us a little update on what's happening within the department with regards to care and service models. We also followed up with that conversation with administrative models, where communities are coming together, or several maybe the tribal council are coming together to provide a value added to the service within Jordan's Principle. And also we heard that they also make payments a little quicker, have that value-added support. We heard from Nova Scotia, who talked a lot about how they are able to support families, how they're able to contract directly to service providers who can then contact the family. So they're creating those relationships that make things easier with the families, providing the support they need. And also they talked a lot about the engagement, how they built that trust with families and how they become part of the service delivery, organization or service delivery arm, or even part of the support structures that families need. So we heard a lot about how they're being very, very innovative in that area. We ended our day yesterday with a discussion on substantive equality, and that was quite the conversation. We brought back Stuart, David, and Sarah, legal counsel, who provide us a little bit of update on substantive equality. And then we had, so that was quite the conversation. It was quite in depth. We had some quite a bit of participation from you out there, and we did not get to all the questions. Which brings us to the first announcement, of course, is that you can participate throughout the session. There's that Q&A button you have on your screen that allows you to send in questions to me that I could then forward to our panels. However, the time does not allow us to get to them all. I try to get to as many as I can. I don't cut off the panelists, but maybe I should. But I won't. But I let them finish their input or their comments, and I don't necessarily get to all the questions. So just want to let everybody know that we will answer those questions. We do not lose those questions, and we'll follow up with you on terms of making sure those questions are answered. There's two ways to that questions, like I said, that hand function, but there's also Jordan's Principle Gathering at afn.ca, and there are people there who are taking your questions also at that time. So you could send in by email, or you can do the little waving hand function on your screen. And of course, we'll be moderating these or keeping an eye on these questions throughout the day. We ask you not use the Q&A function of gathering or the email to share any details about any specific case or to seek coverage under Jordan's Principle. For more information about Jordan's Principle or to submit a request, please call Jordan's Principle call center at 1-855-572-4453. So we wouldn't want to have any kind of private information on our Q&A on our session here. So do use the number if you have any specific requests with regards to Jordan's Principle. If you are having trouble on your device, we do have some technical assistance available to you. We'll have that from 10:30 till 3 p.m. this afternoon. If you can't join us after 3 p.m., it's over anyway. So check the website, and the recordings will be there, which is another announcement. AFN.ca website has all the recordings and all the reports that come from these sessions, and also the agenda and any supporting documents that you might need to fully participate. So do check that out. And I believe there's also a link button at the bottom of your screen that you can click, and it sends you directly to those documents, and you can be up to date in terms of the conversation that's going on and fully participate. Any other announcements? I understand that our elder might not be able to join us this evening to close. He has fortunately had been waiting for a medical appointment, and he got it. So we wouldn't want to hold him up or keep him home if he has the opportunity to go. So I think he's packing his bags and getting ready to go. So maybe we can catch him on the tarmac to say a few words to us before we, but we don't know. Depends on it all depends on whether or not we has coverage on the tarmac. But we'll see if we can. Fort Albany maybe allows people to take phone calls on tarmacs, but we'll see what happens with it. But hopefully he can join us. I understand he's going to try to join us, at least say a few words to us when he has that ability. Maybe to say thank and also to sign off, saying you won't be able to close our day today. Today, what do we have charged for today? Today we have quite the agenda, and I would thank Marie Frawley-Henry for bringing together this crack group of panelists to look at aging out. We're going to look at aging out. We're going to look at it this way. We're going to look at it this way. We're going to look at it like this. We're going to really examine the idea of what happens when supporting First Nations youth into adulthood. And that was a topic that was something that we had a little bit of conversation and some of the issues and concerns you have about that. So we have a team that's ready to provide some information and also take your questions. So Marie Frawley-Henry is going to join us, who's a senior policy analyst, economic development, Assembly of First Nations. Dominic Ireland, who's from the Oneida Nation of the Thames in Ontario. Wait, I better get my updated agenda in case people dropped off and I don't know about it. Dominic Ireland, Marcel Balfour, who is senior policy analyst at the Assembly of Manitoba Chiefs. I think she is joining us. Yes, she is joining us. Marcel's going to be joining us. And Julian, who is our anchor, who's there with us all 3 days, is here to join us. He's also going to be joined by a couple of colleagues. I think because Jordan's principle is very specific in terms of the 18, and I understand there's a lot of issues around that. We'll have a conversation about that. But he's bringing a couple of colleagues with him who can perhaps provide some insight on supports that might be available to adults from the department. And I think Kate Thompson, who is the Acting Director, Home, Community and Preventive Care Division from Indigenous Service Canada, will be available for the Q&As. So just in case, we won't be presenting, but they're there to support us in our Q&As. And Louise Paris, who is the Manager, Assisted Living Program, Education and Social Development Programs, Indigenous Services Canada. So we do have quite the team ready to go in terms of supporting First Nations youth into adulthood. I'm checking to make sure I have any other announcements. Oh yeah, yesterday we had about 1,300 people out there, 1,300. So I just like to say that every time right before we have a panelist, just to freak them out a bit. What we'll do though, before we bring our panelists, I understand Ed Sackney is here and he's on the tarmac. He's coming to us live from Fort Albany Airport. So maybe we can ask our elder to join us. I realize he won't be able to close us. So let's have a few words from our elder before we bring our panelists up to start our first conversation. So there he is. Hi, Ed.
Good morning, sir.
Are you on the tarmac? I understand you're on the tarmac ready to leave Fort Albany.
Yeah. Yes, I am.
So the floor is yours, Elder. If I understand, you won't be able to join us, so I wanted to give you an opportunity to share a few words, perhaps even giving us a closing before we close.
Okay. English, man. I just English ne talkino agay kanagas katye. Ano magano chitaya kama wajakuche. I just want to thank all of you that are here, that have come and joined this conference in dealing with our children on the Jordan River Kartit Manakan, Hajigimatu, Washington, to River Jordan, who was a young child who left us a few years ago, left us a legacy, a wonderful legacy. Kinawa, Ajamaga, Kinochitayak, Anama. And also, it's not you folks that are dealing with that legacy. To help those children that require it. And I'd like to thank our leaders that are leading this. People like Cindy Blackstock, Regional Chief Hart, and several others that I fail to remember at the moment for leading this cause. And don't quit, just keep going. And also, Jordan's principal, and also to all the staff at AFN that deal with this Jordan's principle daily. We do too much. All they want to do is good. And the government of Canada, we wait them walk. To the government of Canada, all I want to say is come and help us. Do it right. We need to come together. Don't fight it. Don't fight Jordan's principle. And also, the reason why I'm leaving early is, as you know, I live in a community that's a fly-in, and I need medical. For medical, we have to go south, so I have to get on the plane to go south to deal with some medical situations that I need to take care of. And when you get them, you take them because they're long and far in between. And COVID-19 hasn't helped that because I had this appointment set way back in July, and now I can follow through with it. So it's been a while. And as well, my first stop is in Moosonee, Ontario, which is south of us here. And we're going to unveil the signage stating where we're going to be constructing our new health center. I'm very happy about that because, it's been a long time coming. They've dealt with this for, I guess, a couple of decades or so. And the staff we have at the regional hospital, the regional area health authority, are all young people that I've been very proud to be associated with. They're people from our area, local people, and we also have some good allies. But the fact is, they're all young, and I recognize that. And the leader we have, the CEO, is from Moosonee. Her name is Lynn Innes. And she's a wonderful leader, wonderful CEO, because she's made things happen. And our chief of staff is also from Moose Factory. She's also Cree. And she's really brought up the recruitment of MDs to our area. Right, in great speed within less than 2 years, she brought up the number. So I'm really happy that we have other Aboriginal doctors that are part of us now. And let me tell you, folks, I think we're going to have a health center that's going to be way beyond its years. So I'm proud of that. And we have an agreement with the Sick Children of Toronto. That's something we're looking forward to, and hopefully we can incorporate Jordan's principle in that location in more ways than one, because of the fact that the reason I love Jordan's principle is that the communities, it has to come from the communities. And without that, we won't get very far. So And this is why I enjoyed working with people from Ottawa, and especially I had the government people come visit Albany from Georgiansville. We're looking after the Georgian Principal huge envelope. They came to my community, and these senior bureaucrats came and looked, and they saw, and they knew what we were dealing with, the reality is. And I think the acting social development leader, Stephanie, came up with them. And they spent a week in our community, and they got to know it. And they also got to know what Georgian Principal can do with communities that are isolated, that don't have road access. So they fully understood that. So I just want to encourage every one of you to keep up the good work. It's hard, but you know, my Gokul and my Mojam used to say, you want to do something good, you got to really work at it. Roll up your sleeves and work at it. And boy, that has come to me more than once, and let me tell you. And they told me this when I was a 3 or 4-year-old kid, and here I am now in my latter part of the 60s, and let me tell you, it's true knowledge that resonates. So I want to thank you for allowing me to speak to you, and I wish you well for the rest of the day, and you will be in my prayers this evening as I say thank you, as I do each day that passes. Thanks, guys. I really appreciate it.
You got you. Take care. Take care of yourself. Safe travels.
Yes, I will. Thank you. I take that to heart, believe me. Okay, later.
Take care. So with that, I'd like to jump right into our first panel. You can tell I'm an extra red today, and I think it's because of the Senators' 7-0 loss last night. I'm kind of embarrassed, just globally. But anyways, I'll recover, and they'll probably win next game and then lose the next game 12-2 or something like that. But it is the season. It is the season of hockey. Let's start this. Let's start this new this conversation about supporting children into adulthood. And with that, I'd like to invite Marie Frawley-Henry, from Senior Policy Analyst at the Assembly of First Nations. Marie, the floor is yours.
Miigwech for the opportunity. Thank you for the opening prayer, Elder, and the closing prayer. And Miigwech for this opportunity. Anin Bojo. My name is Marie Frawley-Henry, and my Anishinaabe name is Mede Wabokwe Nipissing Donjaba. And I just want to say that I'm just pleased to be able to start my presentation here, and to very happy to discuss the tremendous amount of work that we've been afforded the opportunity to do. And I hold dear to my heart the leadership that Jordan River Anderson and the torch that he has passed us to do this work, and I honor him for that tremendous spirit for that work. The Assembly of First Nations has been raising awareness over the last few years about the needs of First Nations persons with disabilities, and facilitating larger discussions on creating greater access to create equitable services, programs, and supports that Jordan so much needed. And for all persons with disabilities, this means youth, adults, seniors, and so many others that just do not identify with a disability, but who require support, access, and services across the lifespan. Slide 2, please. Some of our work obviously is very much led by the Chiefs in Assembly, with several resolutions that are accessibility, disability driven, and we are working with the Employment Social Development Canada to develop distinct First Nations accessibility legislation. And this is unique and distinct, developed by First Nations for First Nations. So we're on a path to determine what that fully looks like. An essential part of this work has been to gather the views of persons with disabilities and First Nations governments to fully determine what would a fully accessible First Nations look like, and realize this together. And The dialogue with First Nations includes discussions on the Accessible Canada Act, and that act received royal assent in June 2019. The act aims to benefit all persons, but there's a particular focus on persons with disabilities and certain priorities identified here on this slide: the built environment, the physical infrastructure, and we're looking at, in not only under infrastructure, we're looking at principles of building universal design. Build from the get-go, build our communities right from the get-go with the principles of universal design, and that's going to be tremendous cost-saving measures. So we looked at design, services, and programs, and employment opportunities, among many others identified here. Slide 3, please. While the Act applies to groups under federal regulated entities or under federal responsibility and includes government departments, parliament, it includes federally funded entities and others, the Act does not reference First Nations overall, and it does not reference the unique and legal historic relationship between First Nations and the Crown. And unlike other federal regulated entities, First Nations do hold constitutionally protected and Aboriginal treaty rights. So the Accessible Standards Canada is also creating and reviewing standards in these above noted 7 priorities on services, programs, employment, and transportation. And of course, the Assembly of First Nations in the self-determining approach is looking to develop services and programs that would define and determine our own standards and approaches as well. So slide 4, please. What we have heard across the last number of years, the AFN heard from numerous voices about First Nations, living in First Nations, the needs, and also so many of our First Nations that reside away from our own respective First Nations because we can't access those services, programs, and supports that other people may be able to access on an equitable basis, but First Nations are looking to access this care in our own First Nations. So we heard from persons with disabilities, experts, regional organizations. We heard First Nations leadership. We were at leadership tables receiving instructions, and we heard from knowledge keepers and national and regional networks, administrators, service providers, caregivers, and so many others. But really importantly, what we heard is the need to discuss ways and means to change the foreign lexicon and labels of mainstream disability language to more culturally safe concepts and strength-based approaches found in our First Nations languages and worldview that empowers persons of all abilities and First Nations governments. The AFN continues to engage with First Nations persons with disabilities and First Nations governments, and we are planning further discussions through several virtual dialogues like this one and others over the next year. Slide 5, please. We also heard the need to address a holistic approach considering the social, economic, environmental factors, essentially the determinants of health. We heard the needs for equitable and accessible supports for First Nations youth as they age out of current programs for accessibility or disabilities and special needs. We heard the need to create more culturally based care for persons with disabilities, youth, and adults, and that includes more access to land, our languages, natural law, our teachings, and culture. This includes empowering access to sports and recreation so that we can have that overall well-being as we move across the lifespan. Next slide. What we heard, we've undertaken several and many different surveys, and through our national webinars, we've had numerous audiences, and we've identified themes that are prioritized by the government, but the Assembly of First Nations and First Nations have determined other themes that are meaningful to First Nations. And we've also looked at, in this slide, you can see we asked employment and training, basically our First Nations receiving meaningful employment and training opportunities. And by this chart, you can see 20% said they weren't sure. 32% said yes, and 48%, almost half, said no. No meaningful employment and training services were offered First Nations persons with disabilities. So we see the need to improve on many of these themes and many areas, but that's just a small sample of the larger story we've gathered. Slide 7, please. We also have a resolution 110-2019, and this particular resolution looks at specific programs and services to support adults with disabilities. We've had undertaken numerous advocacy efforts, and we presented to the United Nations Special Rapporteur on the rights of persons with disabilities. And we are seeking to comment on Canada's report to the UN Convention on the Rights of Persons with Disabilities, so we can ensure that our advocacy is included. And just recently, the United Nations Human Rights Council has prioritized disability. So we're looking to ensure First Nations approaches are heard. We work diligently on the 7 generations continuum of care, because really that's a whole future generations of care access, so that we can really build in that Disability Task Force, Adults with Disabilities Sub-Working Group, and develop a funding policy framework, because we heard funding and resources are very much needed. Next slide, please, 8. I won't go through this slide in total, but you can see that there's many socioeconomic challenges here to address and rights issues to address. And we also have many solutions that we can go forward with that speak to the determinants of health and rights-based approaches. Slide 9, please. We also heard innovation, and we also heard solutions through the social economy and social purpose organizations that offer that if we can lift all persons, and so many of these, this listing here, you can see persons with disabilities would be included in many of these social service programs, and cost governments, save governments obviously resources and funding if we empower First Nations persons with disabilities through social enterprises. And the social economy is a blending of social, economic, environmental values that address the persistent socioeconomic challenges facing First Nations today. Slide 10, please. The cost-effective measures would go a long way to support social purpose organizations that are working hard to replace dependency, exclusion with self-determination, self-sufficiency, and innovation and sustainability. In these programs, we heard First Nations, in these initiatives, we heard First Nations on the ground employing and providing the wraparound services for persons with disabilities through so many co-ops, credit unions, different or social purpose organizations. Our work is linked to family reunification, the United Nations Sustainable Development Goals, Agenda 2030, Transformative Future, and a path for the future for all, and targeted goals to meet the rights of persons with disabilities and to ensure we leave no one behind. Miigwech. I just want to thank everyone for this time. Miigwech.
Thank you, Marie. Nice presentation. Always very beautiful pictures.
Oh, thank you.
Very nice. Thank you very much for that. With that, I'd like to move to our next panelist, who is Dominic Ireland, who is from the Oneida Nation of the Thames. Dominic, the floor is yours.
Wonderful. Just give me one moment. Okay, I'm all set. Fantastic, and hopefully you can hear the interpreter. Wonderful. So my name is Dominique Ireland, and I am from Oneida Nation on Turtle Island, and also Turtle Island. My first language, the Turtle Island clan, my first language is American Sign Language, and I've known American Sign Language since birth. I am a person with a disability. And as someone with a disability, I know that accessibility needs are important to me and important to other people who have disabilities. It's a priority for all of us. I wanted to talk about some of what my experiences have been. And what I've experienced is limited resources and limited ability to participate. I've also experienced ableism and autism and experienced financial hardship because of the barriers that have been put in front of me. Those are the things that I've experienced while I've grown up. And as Marie's comment, her PowerPoint in her slides also mentioned, we know that disabilities are very varying. Not everyone is the same. Everyone experiences their disability different, and there's different degrees of disabilities. Some disabilities are visible and some invisible. I think it's important to recognize also boundaries with culture. So language comes from culture. And so people who prefer to communicate with sign language, as myself, we have a culture, and that includes beliefs and values, and as well as social institutions. So, and also in terms of the PowerPoint that Marie was just going over, supporting youth who become adults and who are aging out of the program, it's really important that there be some kind of a plan for them in place for after they turn 18, because the disability lasts forever, but the program stops at the age of 18. And that will impact them in many different ways. Anybody who has a disability will be impacted by that rule of the Jordan's principle, and their disabilities are forever. So anyone who experiences a shortfall or services being cut off at the age of 18 are going to experience quite a bit of challenges. So I know that there needs to be support for the transition of children who age out at 18 and turn into adults, maybe role models or some kind of a service plan that would help them to get into the services that they would need as an adult, and making sure that it's culturally appropriate as well. And not just once you've turned 18, your supports are no longer there. There has to be some kind of a transition. And also with Marie's PowerPoint as well, I'm hoping that my comments will reinforce what it is that she was talking about in terms of the things that, they've heard from the community. Thank you.
Thank you, Dominique. You went so quick, and then you ended so abruptly. You caught me by surprise. But thank you very much. Awesome presentation. Thank you very much for that. Marcel, I see Marcel Belfour is there, Senior Policy Analyst, Assembly of Manitoba Chiefs. Welcome, Marcel. The floor is yours.
Excellent. Thank you. Tanse, good morning. I should like to thank the organizers for inviting the AMC to present today. The AMC has long advocated for First Nations with disabilities and has developed a strategy and program and policy for change. But sadly, to date, there's been a serious lack of funding to be able to give that any effect. Even with the Federal Accessibility Canada Act, the AMC notes that First Nations were purposely left out to be able to develop our own, which is great, which is good, but all that takes time. And in the meantime, people with disabilities continue to be left out. As well, in that process, the AMC is hopeful that some involvement and engagement from First Nations in Manitoba actually takes place as well. We were asked to comment on the success and challenges that First Nations in Manitoba have faced with respect to aging out of Jordan's principle, and I found it a big challenge to be able to find any successes or things to be able to say in a positive manner. So I'm just going to stick to the facts. There aren't a lot of successes when it comes to aging out, at least in Manitoba, with respect to Jordan's principle. Just want to share with you by way of background that the some of the Manitoba Chiefs and Assembly mandated the AMC Women's Council to look after the files of children and families and the regional implementation of Jordan's principle. And just recently, the Women's Council confirmed that First Nations must be informed on who is receiving funding for Jordan's principle and what it is being spent on, and how it actually benefits our children. That continues to be a focus of the AMC, and we'd originally identified from the beginning of the implementation of Jordan's principle, and they look to Canada to be able to work together to be able to share that information. That comes back to later what I'm going to point out, that we need this information to be able to plan, to be able to identify what are the needs that exist and what has to be developed to be able to facilitate aging out, which our previous presenter identified is no such thing, really. It's only aging out of a program, but not out of a disability. But I mentioned the Women's Council file of children and families because Jordan's principle is intimately connected to that, because with the decision of the Canadian Human Rights Tribunal back in 2016, it was about how Canada discriminates against our children, not only calling to implement Jordan's principle, but also to reform the First Nation Child and Family Services program. I've always looked at them together, that you shouldn't be siloing things. We should be looking at things from a holistic perspective. And in that regard, if we take a look at specifically for Manitoba and what happened or what's happening still with in some instances where First Nations have placed their children in care in order to be able to access services, we look first from our Secretariat perspective on what is Jordan's principle. So for some provinces, it's 18, others it's 19 years of age. So the age of majority, whatever that may mean, is one thing. But that provincial determination is important because in Manitoba, with the Child and Family Services Act, it identifies that additional services can be provided when aging out of care up to 21. And so if that's the case, and if we're to treat folks equitably, the same, equally, so that no discrimination takes place, doesn't it make sense that instead of having to place your kids in care to be able to access services up to the age of 21, First Nations should be able to do that? They should be able to do that without having to rely on funding provided through the First Nation Child and Family First Nation Child and Family Services Program through the agencies or through the province of Manitoba, but rather to the First Nations themselves. There are other issues with respect to funding as it relates to agencies and block funding provincially that go way beyond specifically Jordan's principle. But I think that that's one area or issue that we've identified with the work that we've had from our folks at the First Nation Child and Family, First Nation Family Advocate Office at the AMC, that has recognized that that's great that that service exists. You still have to put your child into care to be able to access them, and that shouldn't be happening. Those types of transitional services that exist provincially through CFS, and maybe being able to identify some type of service up to the age of 21 is not innovation or determination. There is no need for that, so that when kids age out, especially for First Nations with disabilities, really at the end of the day, Canada should be providing funding to ensure that First Nations children, when they reach the age of 18, as adults can access all public services when they need them, and that those services be culturally based and take into full account the historical disadvantages many First Nations face. As adults, they should also have an alleviated administrative burden when accessing services and eliminated service denials, delays, and disruptions. It's similar for whether you're day before 18 or the day after 18. Of course, with respect to CFS and Jordan's principle, the AMC is extremely concerned with Canada's position that the Canadian Human Rights Tribunal orders will not be applicable to folks or First Nations that go under the Pan-Indigenous Bill C-92. For First Nations in Manitoba, it's the Assembly of Manitoba Chiefs that's going to ensure that at least all of our member First Nations are fully aware of this, not only for the implications for their overall CFS and Jordan's principle funding, but on how it could potentially affect them to be innovative and use the funding to be able to at least what is provided provincially in Manitoba. Regionally, First Nations are not provided access to information to access the tracking of data for Jordan's principal services to determine the level of resources and infrastructure First Nations will need to address adults with disabilities, and generally what adults without disabilities should have access to, like others living off reserve. I would encourage Canada to work with the AMC to have access to this information to assist in preparing for what needs exist after the age of 18. From the exclusion of First Nations from the federal legislation to the lack of direct funding to First Nations to withholding of regional data on Jordan's principle, there are many ways that the AMC can work with Canada to properly address First Nations with disabilities and others when they age out of Jordan's principle. Thank you.
Thank you much, Marcel. Excellent presentation. Really giving us a good overview of what's really happening on the ground there in Manitoba. So thank you much for that. Our next panelist is Julian Castane, who is the Acting Director, Jordan's Principal, Indigenous Services Canada. Julian, the floor is yours.
Thank you, Mathieu, and thank you to all the panelists, and thank you to the elder who shared the important words earlier today. For many of you may wonder, what is this guy doing here again? It's the fourth time. I think it's important. I think everybody wants to hear from those doing the hard work on the ground, from the communities, from the First Nation leadership that is innovating, delivering services, working directly for communities and with families. And I think it's only fair that to support them in question and answer, that there's somebody from Canada that's also able to speak to the questions that are directed to us. So that's why I was happy to be part of the different panel to support any questions that are more appropriate to be answered by us. I think this panel is definitely one where we have to listen, where we have to learn from the lived experience and the work that's being done, as it's a very complex issue. I think we've heard from Marie how there's lots of different ways of looking at this and a varying impact. Definitely, we, as we heard yesterday and the day before, are acutely aware of the realities of Jordan's principle being tied to the age of majority in provinces and territories, and of the challenges this critical transition between age of majority means for people, as we heard, where the disability remains the same, but some of the supports are changing, and we've heard clearly that there needs to be additional work done around what's the plan, what's the information that we can share and work on together, so that there is a better ability for people to know what is their next steps in terms of accessing services and what will be available, and for organizations and communities to know about who's that population, what information is available. We've heard the Marcel's question about what is happening right now with Jordan's Principle, what's being done, how does it help children, and how does that information can help us plan those transition, and find better ways of supporting the services that people need as they reach the age of majority. The invitation to work with partners on this is one that we have no choice than to look at in all of our programs and services. And we heard from Marie, there's many departments involved as well in their work with at Employment Social Development on accessibility. That's also why I invited colleagues from Indigenous Services Canada in other departments and in other teams around home and community care and assisted living, as it is the question about how do we create systems of support that are able to adjust and react to the diversity of lived experience and to the diversity of what people are living through when they go through this transition. Of course, no great answer. There is no Jordan's Principle equivalent after we age out. So it does send us to the hard work ahead, to finding solutions that may vary across provinces and territory based on what's available, and also based on what other programs and services are able to do. But I think, as I said, this was important for us to listen. This was important for us to learn directly from those with lived experience. And definitely we will be continuing the work on this as we go forward. Thank you.
Merci, Julien. When we don't have a PowerPoint presentation, I wait on the sides there waiting for someone to in conclusion, then I run back to the stage to see. I feel that at this point in our session, we should have the Brady Bunch theme, and I should be looking to my the other way and start saying, story of a man named Brady. Maybe I'm aging myself there. No one else, the young kids out there have no idea what I'm talking about. I have a couple of questions. I'm looking to my list here in terms of I usually get questions from the group. So I'm encouraging participants out there, if you have any questions for our panelists, do send them in. I do have a couple here ready to go. What is the circle of care that we need to think about to support First Nations children and youth into adulthood? Any thoughts? Go ahead, Marie.
Yes, thank you. Thank you for that question. The circle of care really does speak to the holistic culture-based care that we need, that we heard it was pronounced fully in our engagements, and what we heard, that circle of care would be across a lifespan. Some of my teachings I receive is pre-conception, so that we support the couple before they conceive, so that and my mother and my grandmother being a traditional midwife and medicine women in my families, these significant individuals, and so many looked after each individual across that lifespan. They checked in. So it speaks to those checks and balances within our original governing structures, which my family has upheld, and I continue to uphold those teachings and those original governing structures where we were strong and everyone had a place, meaning whole purpose and belonging. And I see that circle returning. I see our people coming back with our languages again and describing more fully, this is how we look after one another. This is how this circle of care, this is how we belong with one another and among one another. And that will translate into more compassionate economies and more compassionate social and ecosystems that the pandemic has been showing us. There is another world coming, and it has to be more inclusive. And we do have our teachings and our instructions to build in that way that our ancestors have given us for so long. So there is a circle of care that encompasses all this holistic well-being approach, so that we're all lifted up and everyone belongs. It's good.
Thank you, Marie. I don't know if anyone else would want to comment on that, or that's the question. I have a question for Dominique. How can we better support First Nations youth with disabilities? I'm even thinking that we have perhaps have to provide opportunity to even participate in these sessions, much like you are. So I'm just thinking, how can we support youth better?
Yes. So in terms of support, I think we have to start with being open to working together and making an environment that's inclusive and safe. That would probably be a priority, to make sure that people feel comfortable and safe to join in, and finding out what their desires are and how they want to be included, and finding out what their interests are and what they'd like to be included in. Marie's comment was really important about empowering, and I think that would be a perfect start, and it's a perfect word as well, because empowering would make someone feel more comfortable and have the confidence to ask to be included when they're not, and be more willing to ask for what they need in order to be included.
Is there a network available for Dominique? Do you have a network of First Nations people that you can call on to help you or make connections, or perhaps even assist them to find the right connections to get the support that they need?
Well, in general, for persons with disabilities, a lot of discussion talks happen, in public about the needs, but specifically for deaf people, we do have our own language and culture separate from our Indigenous culture. And so that's something that we show support with each other, is by using American Sign Language, and it's something that we connect to each other with. And when ASL is not that it's not allowed, but if it's not being offered to us in ASL, sometimes it can be a really big struggle. I think the best approach is a person with a disability assisting and empowering another person with a disability, and having that role model, because they understand each other's life experiences, and they can talk about what they've been through and how to get through anything in the future. That can happen on a level that two people with disabilities can do together, and then that can grow from there.
Thank you, Dominic. I think that was I was wondering, do you have a support network that could then, bridge that gap to allow you to participate in these kinds of sessions more? And I think that if that, I guess we want to almost enhance that, or how do we bring more people into that circle to ensure that, we're not talking about someone without them being there? That if there are supports that are needed in there, we have to ask those who need those supports, so that they're designed in a way that's meets their needs, So I think it's important to have those people who are requiring those supports participate in these kinds of conversations. So I'm glad we have the ASL translation here or interpretation to allow everyone to participate. I didn't have a...
Absolutely. You're right. Thank you.
I didn't have a question there. Sorry. I'm making statements now. Okay, I do have questions, though. I do have questions. They're coming from the audience. what are your recommendations for transition planning for aging out populations? For instance, Dominique mentioned role models, culturally relevant programs. I don't know who wants to tackle that one. Go ahead, Dominique. Yeah.
Yeah, I just thought of something related to that comment. Let me think for a moment. Knowing someone's personal story and what they've been through and allowing them to talk about that. There was some discussions yesterday about that. And when we're talking about youth to adult transitions, there's not a whole lot of stories being heard about people's personal experiences and giving them the opportunity to show what they've been going through. That's a gap, I think. So once you include youth, then I think, and once you've again created that safe space, I think that they'll, when they enter into adulthood, they won't be as on the fence about what it is that they need to do next in order to ask for the services that they want to ask for. So yesterday they were talking about the processes and empowering people with youth and knowing what their desires are. And the priority again would be just making sure that you know their story and where they're coming from. And so then that way, again, when you talk about role models, a person with a disability speaking to another person with a disability and knowing what they've been through and actually seeing what they have experienced to help you get through something in the future, and knowing what other people's perspectives are, because everyone's situation is so different.
I think you're quite right. But I find that sometimes it's the parents who have a lot of pressure to advocate on behalf of their children that need these kinds of support. So I guess it's we want to make the parents participate because sometimes that's their voice for the child, but also we want to hear from the children, right? So you're balancing both. And I guess it's providing these venues and being more open to hearing that voice. I guess is probably the most important. How can we make this easier for everyone to participate, including the parents, including those who require those supports? I don't know if I have a question there. Again, I don't know why I keep babbling on without a question.
Can I speak to that as well? Yeah. Additionally, thank you, Dominique. That's excellent. We, that first voice experience is so essential, but there's such a complex system of care and system of supports and family supports around. It's really amazing. Once you look at One Life, you see that whole system of care in that family life, lifelong caregivers, parents, the extended family. So often they are so busy just looking after survival, and they are so impoverished. I've spoken to so many. It's a system that keeps our people impoverished, and that whole system, we need a whole systems change, and this is going to bring us all together so that we can see those checks and balances, so that we can fill in any gaps to ensure that the approaches are meaningful and that this is life-giving support services and programs. Thank you.
So I guess the next question I have here is when will non-insured health benefits recognize that they have a fiduciary obligation to provide cradle-to-grave substantive care to First Nations? I don't know if anyone's in a position to answer that one. Maybe I'll go to Julian.
Yeah, I think that sadly, I don't have colleagues from the Non-Insured Health Benefit Program with us to answer this question in more details, but I know they've been doing lots of work around the Non-Insured Health Benefit Joint Review with the Assembly of First Nation and the NIHB navigators. There's been some expansion over the last few years in certain benefit areas that are supporting a better ability to meet some of the needs, but clearly, as we are hearing for other systems, programs, and services, all of our programs, all of our departments have a role to play and have questions to ask themselves around how best we can provide that additional layer of responsiveness to disabilities or to other kind of exceptional circumstances. So I'll be happy to follow up with our colleagues in non-insured. They'll benefit to convey the message that we've just heard from this question.
I was wondering, I guess we have Kate here and Louise here. I'm wondering if you're hearing anything, or people who are preparing for that transition. They have, organizations or programs and initiatives that are working with youth or with those who are minors right now. Are you hearing anything in terms of that transition planning? Are organizations getting ready for those, I guess, the supports that they provide to those who are before they're 18? Are they preparing for that transition? Are you hearing anything out there in terms of organizations or programs that you're funding around preparing for that transition?
I can take a first kick at it. This is Kate from Home and Community Care, and I want to thank the AFN for having me. I want to acknowledge that I'm on the traditional, unceded, and unsurrendered land of the Algonquin people, and I myself am a settler from Treaty 4 territory out west. So thank you for having me. In terms of your question, excellent question, and like from my perspective with Home and Community Care, it's been a program that has been in place for many, many years. The foundation of our program is that we provide a range of basic home and community care services that enable, or the aim is to enable First Nations and Inuit of all ages with acute or chronic illness or disability to receive the care that they need in their homes and their communities. We've certainly been giving some thought recently to what that might mean in terms of children that are reaching the age of majority. With the Home and Community Care program, it's not age distinction based, like anyone can receive services. And in fact, in the fiscal year of 2019-2020, we provided services to upwards of almost 1,950 children, less than 25. So that's certainly an area that we might have been working in parallel, and lots of opportunity, I think, to address those planning needs as we move forward. I really liked what the panelists had to say about that need to identify and collect the data about how, like, gaining that information so that we can make those solid plans. So I'll maybe leave it at there and turn it over to Louise if you want to comment.
Yes, I can provide a little bit of input on, I don't know if people hear me, I hope so. So on the assisted living program, basically there are things that are already available and that we are a little bit puzzled as to why there's so little uptake for that. And I'm going to explain quickly. So the assisted living program serves people who need support for independent living. And it can go from home care to institutional care, like on long-term care facilities, for example. But there's a component of the program that we call adult foster care, which is basically for people who need support on their daily living for various reasons, and that are not necessarily, the typical type of elder people that would go into the typical long-term care facility. So this could be group homes. This could be people living into a foster family because they need support on a daily basis. It could even go to, supervised apartments and things like that. So the assisted living program is not a healthcare program, so it cannot provide a lot of hours of health care type of support. But if you see situations like, an adult that has some developmental disability and they need supervision and support with their daily activities, this is something that we can support. The program is not geared to brick and mortar, so we cannot build facilities for that foster care component, but we can provide the funding for the operations of that for the individuals that need the services. So why I said at the beginning that I was puzzled is that on the long-term care side of the program, we are serving about 10,000 people across the country. And on the adult foster care, we have about 100 clients year on year. It could be a little bit more, a little bit less, depending on the years, but there's a very low uptake of that. The other point that I want to raise is that we have started an engagement process on holistic continuum of long-term care. And the word long-term care might be misleading here because we're talking about any kind of service that would be needed on a long-term basis for by people. So it's not limited to the traditional definition of long-term care. It's anything, home-based or facility-based care and any kind of services. So this engagement has just started. So I would encourage people in all the regions to talk to their regional leaders to see what is brewing in terms of organizing in each region for providing input in that process, because there's a lot of room in that process to raise the issues that were discussed this morning.
Would it be possible to put that link on the AFN website, or in terms of the terms and conditions around that program? I'm guessing there might be a communications issue or something around maybe perhaps communities don't understand what they might be able to access. So I'm just wondering, maybe we just need to get more information out there, or the details of what they can.
We can share after the meeting the link to the description of the assisted living program on our website, on ISC website. In terms of the engagement, there's a lot of information that has already been shared with the AFN about this engagement, and also with regional groups. So it's pretty much easily available, or people can talk to their region, the ISC regional offices, to get the guide for the engagement and see where the discussion is at in each of the specific regions. And I'm insisting on regions because we know that on the continuum of care, for people who need care on a long-term basis, there's a lot of back and forth between the provincial systems and the services that are offered on reserve, for example. And that's why we're making this engagement very region specific. There will be at the end, policies that will be national, but we want to design them in a way that will accommodate the differences between various regions on how these things can be, elaborated and fleshed out to work in each of these contexts that are different.
Questions. I'm just wondering about that. You're talking a little bit about the differences again within jurisdictions, and all Jordan's principle was a whole conversation around different jurisdictions and different supports around those jurisdictions. And I'm wondering, I guess, do we understand where the gaps are? Do we understand, if you have supports when you get 18, do we understand really where we're falling, or where we're falling off in terms of that continuum? Because we keep hearing there's an issue, the supports are not there, or there's some concerns around, I guess, parents when their children turn 18, if the supports will still be there. Do we have a good sense, or is that going to be part of that conversation on where the gaps are at 18? Like where do the supports drop? And perhaps, looking at where can we pick them up and ensure that those supports are there. So do we have a sense of where the gaps are?
Well, that's why we do an engagement. We know that there are gaps, and we know that it's complex, and we don't have all the information. So the engagement is supposed to be tripartite also. We cannot force anyone to participate, but our hope is that the conversations will take place with province and territories where, these things can be raised, and part of a solution might be with the federal, but part of a solution might be with other players. So,
and if I can add back to Marcel's earlier point on Jordan's principal data, like we do have a sense of what's being accessed right now by children and youth under the age of majority. And that is not a complete picture, because Jordan's principle, like we only know what we receive requests for, but it is a place to start. It is a place for us to better understand the impact of that transition. And it is, from what we heard from Marcel, an invitation for us to figure out how we can work with that data, share it with those who need to be doing that thinking around how to best position the supports for that transition period.
I guess, would that data be available for Louise's conversation? I'm thinking about all the regional, maybe information that they would be probably inform the conversation, I would imagine.
That's definitely the intention behind a lot of the work we've done on the data front. Yesterday, we've mentioned the deep dive on the administrative data that we've shared with provinces and territories, that we've shared with other programs and services, with regional partners. It's a starting place, and we know that there are more details that will answer more specific questions that we need to continue working on. And I believe that this question is definitely a priority for us to find ways of better kind of showing the data that is available to help those involved in those conversations around the engagement for a continuum of long-term care. As well as those who want to do more specific transition plan specific to their communities or the children.
So I'm checking the time. I know we started a little late, so I want to go to at least 20 after before we take a break. There's quite a long little question here, and I'll read it out to you. In Manitoba, people living off reserve with significant disabilities qualify for a lifelong financial and social support funding called Community Living Disability Services. If they are on reserve, they do not qualify. In some communities, the Band Council creates resources, but this is inequitable compared to the rest of the population. Is there a solution in the works to fund housing, food security, clothing, and vocational needs on reserve?
That's definitely, again, a question that speaks to broader systems in place. As we discussed, Jordan's principle is playing a role in some of those categories of supports that you've just outlined through that question. And then the programs and services for adults, it does kind of send us back to what we've been discussing, that it's a big part of a work in progress and the overall infrastructure of systems and programs and support that is managed by communities, and that we know that there's still some gaps that are persistent and require our collective attention.
Thank you for that. I don't know. I got a couple of minutes. I want to open the floor to our panelists. If anyone had any last comments they would like to share to our audience. Everyone said enough. I think the only other question I had, and we have, was how is the two-eyed seeing approach to care being encouraged at the national or regional levels? I don't know. Is everyone aware about the two-eyed seeing? Julian, was he?
Well, I by no means am an expert in what Elder Marshall developed around the two-eyed seeing. I've learned enough through my years of being taught by health directors to know the importance of looking at the systems that we have, the issues that are in front of us from a two-eyed seeing. And I think that within Indigenous Services Canada, there is a lot of support and leadership for us to have a cultural competency training approach. Recently, it was recently rolled out that all Indigenous Services Canada need to do a minimum amount of training and development to increase our ability to understand the realities and to have a better cultural awareness and increase our collective ability to do our work in ways that will have more ability to fit in what communities and First Nation leaders and workers want to see. And a lot of our program areas have gone through kind of series of changes and opening up flexibilities for cultural activities, for on the land approaches. I know that the mental wellness programs have definitely tried to open up to those possibilities, as we know that there's a more holistic definition of health and wellness in First Nation communities. So for ourselves, I think it's a matter of continuously learning, coming to the table with an openness that we do not have those solutions, that First Nations are the expert, that First Nation know what will work in their context, and giving ourselves the challenges of making the changes and adjustments in our system to try to best support First Nation-led and First Nation-driven systems and decision making.
Julien. That brings us to the end of Supporting First Nations Youth into Adulthood panel. So I do want to thank Marie, Dominique, thank you very much for joining us. Marcel, thank you for joining us from Manitoba. Julien, merci encore. Kate and Louise, merci for joining us today. So thank you very much for that. That was a great panel. I think we did have a good conversation there about transitioning from Jordan's principle. We'll get you, everybody. Miigwech, à la prochaine. With that, let's take a break. Let's take a quick break. Let's take 15 minutes. Let's come back at 25 or 35. So 12:35 or 35 minutes past the hour, wherever you are across the nation. So let's come back in 15 minutes. Do enjoy your break. Do charge up, and we'll be back on our conversation on ombudsman roles and function. Take care, everyone. See you soon. Welcome back, everyone, on our virtual gathering on Jordan's Principle. My name is Matthew Castane. I have been your facilitator for what has been 2 days. I guess if we combine them all together, it's almost a day and a half. There you go. Our next conversation, Jordan's Principle, ombudsperson role and function. Now, I was thinking, you know how we always have these open words that we used to use, like we use fisher person, or a fisher, or a ombudsperson. But I was thinking, what's the verb, right? And I said, well, what's an ombud? So I guess I was looking it up, and I said ombud is borrowed from Swedish. I didn't know that, where it means representative, and ultimately derives from Old Norse words both commission, and marth, which is man. So I guess that's old Swedish, so it would be person then. And so I was wondering, is there a verb? If you're a fisher person, you're fishing. If you're ombudsman, you're ombudsing. I don't know if that's a word, but I guess it might be a word, ombudsing. So with that, we are joined by two guests, Naomi Metalik, who's assistant professor at the Schulich. Is it Schulich?
Schulich, yeah, you got it.
School of Law, and Shelby Thompson, who's a lawyer. So again, we can't have a day without at least having a panel of lawyers. So here we are, being consistent with that requirement. And with that, I'll cede the floor to Naomi Metalik and also Shelby. I think you're joining same PowerPoint presentation. And as per usual, we'll open the floor for questions. So welcome, ladies, and the floor is all yours.
Thank you very much, Walalio. Gwe Wildasi, Begisin Giskuk. I'm very happy to be here today. Davizi Naomi Metalik. I am Mi'kmaq from the Listigouche Mi'kmaq First Nation, although I now live in Halifax. To tell you a little bit about myself, and then I'll allow my friend to introduce herself. I am a lawyer, as Matthew pointed out, and also a professor. And over the last 10 years, both in my legal practice as well as being a professor, have done a lot of work, and we're going to talk about that more, around child welfare, but more broadly around essential services for First Nations, and issues around funding and accountability come up around that all the time. So that's sort of the short background that brings me to this project, and having worked with Cindy Blackstock on these matters over the years. I don't know what the verb is for ombuds either, but I think the one point I'd like to say to get into this is that really, and we're trying to even shift the language not to ombuds that gets very specific to more about accountability of governments. And we'll get into how really what we're looking at and the work we're doing is really to help find different functions to ensure even greater accountability of different levels of government. So I'll stop there and allow Shelby to introduce herself.
Hello, everyone. I'm Shelby Thomas. I am Métis, and I am a third-generation Dutch and Polish settler. I'm a lawyer currently based in Treaty 1 territory, the ancestral land of the Anishinaabe, Cree, Ojibwe, Cree, Dene, and Dakota people, and the homeland of the Métis Nation. I would also like to take the opportunity to introduce my black bear friend back here. They were actually gifted to me from Dr. Blackstock and Spirit Bear, and I have been granted the sacred duty of training this bear to become a barrister, just like me, just like Naomi, and just other lawyers. So we are really excited to be sharing this virtual space with everyone today.
Great, thank you, Shelby. And I've also been gifted this bear weenage from Cindy. I'm not as dutiful, I think, as a bear parent as you are, but I have lots to learn from you, so thank you. So to get into our presentation for today, I think I'll ask to go to the next slide. Perfect. So for the next few slides, what we're going to do is try to break down why. So we've been asked to do some work, and we'll get into the details of the project. The use of looking at an ombuds function was put out there. but we actually, it's broader than that. Ombuds function is a type of body that holds governments accountable in different ways. But more broadly, we are looking at different ways of accountability and the creation of we're looking at different models of bodies that can be created within the existing sort of things that we have to address underfunding of services and child welfare issues, to try to hold governments more accountable. So the first thing we want to do, though, is kind of to unpack that more. Why is there a need for greater accountability? I'm sure many of you on this call have some sense of it, but it never hurts to sort of go back and look at what's going on and why is there this need. A place to start, but actually it starts about 20 years plus before that, is the 2016 decision in Caring Society. That was several years in the making, and it certainly wasn't Dr. Blackstock's first choice. She had started the Caring Society, I believe, back in the 90s, and at that point began her quest to address what she had recognized in her work as a social worker of the systemic inequality, particularly of First Nations agencies operating on reserves. And so she brought this issue to the attention of government, recognizing there was significant underfunding. She had reports, I think 2 reports done, I believe in concert with the federal government, clearly indicating where there were inadequacies, inequities in funding. But that did not result in substantial, significant change. And so in 2007, she felt compelled to bring, with the Assembly of First Nations, a human rights complaint against Canada. And it was several years in the process. It took about 9 years to finally get a decision. There was things that happened, in that period too, where the decision almost got dismissed sort of early on and had to go to the Federal Court of Appeal. Anyway, these things that's why it took 9 years. But the ultimate decision from the tribunal is really important. It addressed and clarified some issues that had been matters of debate and are sometimes still debated today. Which is one of the reasons that, we need greater accountability. But the decision is helpful because it does a few things. Number one, it confirmed that Canada had Section 9124 constitutional jurisdictional responsibility with respect to First Nations child welfare. Leading up to this, and also with respect to various other services, the federal government had maintained that it funded these services but wasn't responsible. It always tried to argue that the provinces were in fact more responsible. And in turn, the provinces would say that the federal government was responsible. And, this sort of hot potato issue of it's not my responsibility, it's yours, is a really key driver in the need for accountability in this area. Second, the decision confirms Jordan's principle. I'm going to unpack that a little bit more on the next slide, but it's really important. 3, the decision found that systems that recreate or perpetuate historic disadvantage or assimilation is discriminatory. And what they basically found was that the child welfare system was effectively mirroring the Indian residential school system by, resulting in the overrepresentation of so many Indigenous children being taken into care and often being put with non-Indigenous families. And so systems like that, they said, are discriminatory when they, involve a significant assimilation and when the government has such massive control over the lives of Indigenous people. Another really important part about the decision is that the tribunal held that the comparability standard, which is basically the standard that Canada says it applies, although it doesn't do often a very good job at measuring whether it actually meets it. But what that means is that it's trying to provide a level of services and funding similar to the provinces. But it was found in the tribunal decision that Canada was not meeting even that level of services, and it didn't really measure that, even though several Auditor General reports called on it to do so. But they said, even you're not meeting that, but that's actually not the right level. You can look to what, you know, the provinces are doing, but what First Nations children and families are actually entitled to is what is called substantive equality, which means they are entitled to services that meet their distinct needs and circumstances, including cultural, historical and geographical needs and circumstances. So that was a really important finding, because often the government has been using provincial standards as the only measure. And the tribunal said that's discriminatory. Can I get the next slide? So the tribunal ordered several things, but one was, and this is written in the decision itself, and usually tribunals don't write decisions where they use all caps and underlined. So that just gets across the point how important and how significant the tribunal felt that there had to be real reform of the First Nations Child and Family Services Program in order to build a solid foundation for the program and to address the real needs of First Nations children and families. Next slide, please. I said I would come back to this. The tribunal also, you know, says some really important things about Jordan's principle, and in this whole conference is about Jordan's principle. And I'm not going to read out the full-on text here. Sorry to hit you with a wall of text, but the main point, I think, that, or the main takeaways, is that Jordan's principle was discussed in a way that clearly positions it as a human rights principle. It's more than just a resolution of Parliament. It is a human rights principle, and it's that human rights principle that helps us address that really nasty hot potato issue that, you know, always going back and forth. And it's about trying to deal with jurisdictional disputes, not just between the province and Canada, the provinces in Canada, but also within departments. So that was a really key point. That's the first paragraph there. And in the second paragraph, the point that's really important here was noticing that even within the federal departments, it was a very siloed approach, and that various services go into fulfilling the needs of First Nations children and families. And that's important for the various programs and components of those programs to work together for the well-being. And if they're not being coordinated together, then that itself is another example of a Jordan's principle violation. So those are really two key important points about Jordan's principle. Can I go to the next slide, please? Next slide. Thank you. Again, I'm not going to read through all of these, but the so that was the first decision from the tribunal. But as you know, there have been several non-compliance orders since the ruling, the initial ruling in 2016. I've lost track of how many times Cindy has had to go back to the tribunal. I think Shelby is counted, so she can tell us after. There has been several rulings in finding that Canada was not complying with its order to take a broad approach to Jordan's principle. It had to be told numerous times to take a more a broad approach. There were several decisions that dealt with who is entitled to Jordan's principle, and their most recent decisions are fairly broad. It's all First Nations children resident on or off reserve, whether or not they are registered under the Indian Act, so long as they are recognized as a member of their community, or they have a parent who is recognized or able to be registered as an Indian. So that's a broad approach to the children that are covered by this. Yeah, and almost similar to, you know, the needs-based approach and the substantive equality, they say the Jordan principle should be based on the needs of the child, right? And not just limited to the normative standards of care. That idea of normative standards of care is really a reference to comparability again. And comparability is, you know, looking only at provincial standards. But recall that substantive equality means that you don't just look at provincial standards. So that has tried to be emphasized over and over again. Yeah, and that, you know, there are also parts of these rulings that speak to, you know, doing things in a timely way and timelines around responding to requests for services. Next slide, please. I'm going to turn it over to Shelby for this one.
Yeah, so there's about 15 plus decisions related to the Caring Society matter. So there's a lot to go through there. So I'm going to talk a little bit about developments in Indigenous Services Canada related to Jordan's Principle. So in response to the CHRT orders, Indigenous Service Canada has made some changes in an attempt to remedy and address the discrimination experienced by First Nations children. From what we understand, Jordan Principle navigators and service coordinators are essential resources in improving First Nations access to services, supports, and resources that meet their unique needs. There is also currently an internal review appeal option available for decisions made in relation to Jordan's Principle requests. From what we understand with respect to that, this process is being refined and revised in an aim to improve its operations. Although progress has been made, it is important to also acknowledge that there are still problems in realizing the full implementation of Jordan's Principle. From what we currently understand, the current service provision is primarily and simply meeting the normative standard of care that Naomi's touched on quite a bit, instead of that required equality or substantive equality standard. There are less approvals are being received for group requests over individual requests. Therefore, there's this gap in addressing those systemic issues. There's a lack of action from provinces in respect to their responsibilities in providing for the needs of First Nations children. Primarily, there's no established process to interact, collaborate, involve, or hold provinces accountable in their responsibilities. Next slide. It's going back to Naomi.
Thank you, Shelby. So a few more things to sort of add to. So we've got the Caring Society decisions and several non-compliance orders that have come out since. We've got developments at ISK, but there's more, right? So a couple of other recent developments have been legislative. Canada has passed a couple of acts that touch on the question of services to children and families. So the first one of those is the Department of Indigenous Services Act that was passed in the summer of 2019. This, you might remember, we had Indian Affairs or Indigenous Affairs before that, and it was split into two departments, CERNAC and ISK. With that split, required legislative changes to create these departments. And the change with the new Indigenous Services Act actually added a lot more to, I mean, not a ton more, but some important things that had never been in the previous Department of Indian Affairs Act, which actually from a lawyer's perspective are good things. I call them tools to use to try to hold the government accountable for providing services, equitable services to First Nations people. So a few of the important things that are in this new act is, for the first time, it lists specific services that the department is responsible for providing. Recall in the past, as I said before, in Caring Society, Canada took the position it was just a funder, but didn't really have a real legal responsibility. It was just doing it as a good public service. But now the government recognizes that in law. And as you see here, of course, sub A is child and family services. But as you all know, all of these other services interlock or interact with each other to form the total picture of what a family and children need for well-being. So it also recognizes education and health, social development, economic development, housing, infrastructure, emergency management, and also governance. Beyond that, there's also a requirement in the Act at 7A, it's the bullet right underneath it, for the minister to, quote, provide Indigenous organizations with an opportunity to collaborate in the development, provision, assessment, and improvement of the above services. Now, the way I read that and some of the other language in the legislation is to put a positive onus on the department to consult with Indigenous groups with respect to changes in relation to these services, something that it never felt that it had an obligation to do. I was in my legal career involved in a case about social assistance or welfare, and the government made some pretty significant changes that we were very concerned about here in the Maritimes, and the department had the view that it didn't have the obligation to have to consult with respect to any of those, saying that there were not Aboriginal and treaty rights. Well, now with this language in the legislation, the government has committed itself to collaborate with Indigenous people over these changes. So I think that that's important, but it requires oversight and holding government to that obligation, which is, you know, coming back, we're going to come to around to why we need some things, functions or mechanisms for accountability. Beyond that, the other thing in the Act that is interesting is in the preamble section, which as a lawyer, I'll tell you, is relevant to interpreting what the department does. There's several things in the preamble that talk about how service delivery by ISK is to be provided. So, for example, there's language about that its services should be transparent, that its services should be needs-based, that it should take into account socioeconomic gaps, that it has to be concerned with Indigenous individuals' health and well-being, that it should promote Indigenous ways of knowing, being, and doing, and work towards the gradual transfer of its responsibilities to Indigenous organizations. So I read that as transition to self-government. So those are all things that didn't exist before 219 in terms of legal obligations in law with respect to ISK's provision of services. So that's an important one. Next slide. The other piece of important legislation I'm sure you're aware of, perhaps more than the last one, is Bill C-92, we all call it, but the longer title is an act respecting First Nations, Inuit and Métis children, youth and families. The act does a couple of things. The first one being is that it sets minimum standards with respect to some aspects of the delivery of child welfare services. Currently, it's across the country, it changes, the rules change from province to province in terms of child welfare. And there can be differences specifically with respect to Indigenous treatment of Indigenous children. The idea with the minimum standards is to set a sort of a minimum bar across the country with respect to provision of services that are geared at being more culturally responsive and including Indigenous organizations and governing bodies in the process where a child might be in the child welfare process. It does more than that, but I won't give a whole presentation on it. But it also requires that in the delivery of child welfare services that these services meet the standard of substantive equality. Right? So again, there's a standard that has to be met. And so this raises accountability issues of ensuring that those who have responsibility to carry out these minimum standards are meeting those, right? And that's all kinds of different people or organizations. This act has to be basically implemented by provincial agencies, by First Nations agencies. It also requires lawyers to be involved, legal aid, other lawyers, judges. So there's a bunch of people who are sort of involved with this that need to be held to these minimum standards. So again, that raises another accountability issue. And one thing that is challenging about the legislation, there's a few things, is that it doesn't set out clear remedies or accountability mechanisms for when people don't necessarily meet their standards. You know, you can take somebody to court for failing to follow their legislative responsibility and get an injunction to force them, but that's a little tough to do and it's expensive to go to court. But so there needs to be some thinking around that and trying to, think about how to hold people accountable to their obligations that the government's now set out in this act. The second thing that this act does is it recognizes the inherent right to self-government of Indigenous peoples with respect to child welfare. So it recognizes the ability for Indigenous groups to pass their own laws and also to have their own adjudicative authority. Or by that, I mean their own court or tribunal or some body that decides child welfare matters. Now, there's a process that is set out in the legislation about how that comes to pass. Part of it involves the Indigenous governing body that wants to take over child welfare services to give notice to the federal government, and then to attempt to enter into coordination agreements with the federal government and the province that they're in. There's, like I said, some more challenges in this legislation is that there's no specific commitment to funding or to tell us which government between the feds and the provinces have the responsibility to fund. And I've always been concerned that this brings us back to that hot potato game that we always end up back at. So, you know, the legislation does say that if there is a sort of impasse and on trying to come to a coordination agreement, that there's supposed to be a dispute resolution mechanism that can be created through the regulation power under the Act. And I think that is, on the one hand, a good thing, although I would have preferred just to see a dispute resolution created within the Act itself. I have seen examples where the feds say we're going to create something through regulations, and then they never do. A few years ago, there was this water bill on reserve in 2013 that was passed, but the whole regime was based on the need to actually have regulations sort of kicking it into place. And that never happened. So concerns with, you know, the accountability in terms of developing a dispute resolution mechanism for dealing with disputes around coordination agreements, especially the funding around that. And currently, to my knowledge, I haven't heard of any work taking place yet on this dispute resolution mechanism. Can I go to the next slide, please? Okay, a few more developments. This is switching from legislation or laws to human rights decisions. So we talked about the Caring Society decision, which was from the Canadian Human Rights Tribunal. But we're also starting to see some decisions from provincial human rights tribunals on similar issues of lack of services to First Nations. So a very recent one is from Manitoba. So it's called Sumner Pruden versus Manitoba, and Manitoba is currently appealing it. And it's not a perfect decision, but it is good in some respects. So here we had a mother and child living on reserve in the province who had various, the child was quite ill and were denied various health services by the province. And so they brought a human rights complaint to the Human Rights Tribunal of Manitoba. And it was held that this was discrimination, that, you know, Manitoba had an obligation to provide these services. And in fact, what the tribunal said, and this is true, that both levels of government have an obligation to provide these services, but neither can rely on the fact that the other one has the obligation to excuse it or to justify not providing the service. And that's so important, and it's so great to see this sort of finally being set out in decisions. So you see this quote here, number 25. Manitoba was trying to say that the discrimination was justified because, you know, Canada has primary services responsibility to First Nations. And the court said, well, Canada has jurisdiction, but so do you. It's concurrent. And my favorite quote here from the decision, the court says, the Canadian constitutional framework does not amount to a reasonable justification for the discriminatory treatment of the complainants. And that's so key. And that's been happening for 80 years. They've both been relying on the division of powers to excuse themselves from not providing equitable services. So this is great, but we need, you know, more accountability around this. Okay, next slide. Over to Shelby. because she was on the MMIW inquiry or worked for the MMIW inquiry. So she's an expert.
Yeah, I was Associate Commission Counsel with this inquiry, and I'm sure many of you are kind of familiar with the work that was done into the National Inquiry into Missing and Murdered Indigenous Women and Girls. So I'm just going to provide a brief highlight of some of the things the Commissioner recognized from that process. So essentially, the commissioners recognized the interjurisdictional neglect experienced by Indigenous people. Essentially, that's the gaps in services and resources available to Indigenous people. They're not getting the services and resources that they deserve. And then the other thing they realized too is there's a lack of options and available mechanisms for Indigenous people to have their rights respected. And essentially, in recognizing these things, the commissioners have called in 2 different calls for justice with respect to accountability. And they have called for the establishment of an independent oversight or accountability mechanism that is there to ensure the rights of Indigenous peoples, particularly at Call for Justice 12.9. They're asking one specifically for First Nation or Indigenous children and youth, and having something there to help them make sure their rights are respected, and, you know, representing their interests in areas that need to be represented in. Next slide, please. All right, so we're going to briefly talk about this. The Honorable Senator Moody tabled a bill of law to establish the Office of the Commissioner for Children and Youth in Canada. And I'm just going to start by outlining a couple of aspects from the Act, and then Naomi will be providing some further commentary with respect to this bill. So essentially, based on the purpose of this bill or this Act, we can consider this an attempt in creating a federal children's and youth advocate. The bill outlines a wide variety of roles and responsibility of the office that start from education and go to advocacy. There's even like encouragement clauses in there. The office has limited enforcement abilities. These are kind of just directly linked to their investigation powers and the ability to access information for them to conduct their investigations. The bill does provide for some specific duties to consult, collaborate, engage, and assist First Nation, Métis, and Inuit children, youth, and governing bodies. I'll point out specifically Section 16 requires that consideration be taken to appoint a specific commissioner for First Nations, Inuit, and Métis children and youth. This is in fact not a true obligation, I would say, and I'm just going to turn it over to Naomi to provide a little more commentary with respect to the bill.
Yeah, so the bill has been critiqued. Cindy has been vocal about her critique. Senator Brian Francis, a Mi'kmaq senator, has also raised concerns about it. It's a step towards trying to create accountability around children issues at the federal level. But from the First Nations, or for some First Nations perspective, and I've weighed in on it too, and so has my colleague Hadley Friedland, who's not able to join us, but is part of this project too. I think I would summarize the issues with it is that it does seem that First Nations or Indigenous children are kind of an afterthought. Like there's a commissioner, but they don't have a specific relation or direct link to First Nations issues. It's sort of considered as part of the bill, and as Shelby was pointing out, the language is that they shall consider. They must consider, not appoint, but must consider appointing an assistant commissioner with a focus on First Nations, Inuit, and Métis children and youth. And I think that the sort of big question mark that goes off for a lot of us who do the work in this area is that first, Indigenous kids are really the only kids that the federal government has like a direct responsibility with and in providing services. Like for the most part, other kids in this country really fall under, you know, service delivery of the provincial governments. Yes, the provinces have responsibility to Indigenous kids as well. But, you know, for the most part, even though they've, you know, done an inequitable job and have, you know, had human rights complaints brought against them, the federal government is the one who's been fulfilling this role for 70 years or so in terms of service delivery. Well, beyond that as well, but in a more regularized way. So the issue here is that Indigenous children are not the focal point of this bill. People have raised. And also there are like gaps in this legislation in terms of, you know, I reviewed earlier the new Department of Indigenous Services Act and Bill C-92. This act doesn't link those two or how in any way there's going to be oversight with respect to those acts. You know, and you would think that that would be an important thing, especially with the federal government's connection to Indigenous children. Yeah, and there's been some other reports that have, you know, basically found that the report it's just not meeting Indigenous children's accountability needs, what's being proposed there. I could go into more detail, but I think that covers the ground of it. And there's no real remedial powers. There isn't a lot of teeth there, and that even some of the powers that they're given is not enough given the history of the relationship between the federal government and First Nations or Indigenous children, you know, especially like in terms of real oversight. So yeah, not a perfect bill in terms of what is on the table with that, but it's another part of the matrix of what's, you know, informing what's going on and the need for accountability. Next slide. Okay, so that all leads us finally to getting to the project that we're involved with. ISK has expressed an interest in establishing an ombuds person. That was the language that was used, but I understand from my discussions with everyone so far that it's really more about accountability, right? And ombuds is a form of that, but it's not. We're not locked into necessarily looking at just that, but it's something that we're looking at, among other things. Yeah, and so they are interested in having, you know, in looking at this the prospect of creating something that is going to ensure greater accountability, to address continued and consistent barriers and challenges in realizing the full implementation of Jordan's principle. So we were approached, myself and, like I say, Dr. Hadley Friedland, who was a social worker in a past life and is a legal scholar too, and does a lot of work in this area. So we're working on this together, and we brought on Shelby to help us do a good bit of the research, and we'll unpack what that looks like shortly. And the end goal is for us to put forward at least 3 well-researched options for an effective Jordan's principle accountability function. So we're still, you know, looking at, we're doing research on looking at what that looks like. Could be an ombuds role, could be another role, could be a hybrid of different things. So there's nothing is sort of predetermined at that point, but we're looking at the various options. Shelby.
Next slide. So in order to fulfill this research mandate, the work was divided into 3 parts. So part 1 involves gaining a better understanding of all the different options for accountability mechanisms. This is important to the work as it will help us determine effective ways of ensuring accountability and making that change that we need to see. Part 2 of the research involves becoming more aware of the current application of Jordan's principle and the frameworks involved in that application. And this is also a pretty important part, as it will help us better understand of how an accountability mechanism will best fit in ensuring the application of Jordan's principle, and with all the other kind of moving parts related to that application. And then the last part 3, involves learning from various key stakeholders involved in implementing Jordan's principle. And this is to help us make sure that whatever is kind of determined as options, that this accountability is actually equipped to address the issues experienced and support the work in fully realizing Jordan's principle. And as we have been working through this project, we quickly learned that before we could move to part 3, we really had to get a good understanding of what's available out there, kind of what are the issues, what are the concerns involved in accountability mechanisms, how can any of those challenges or barriers be addressed. And so we have progressed considerably in our review and analysis in part 1 and 2, and we're reaching a point where we're getting that foundation of understanding. And we are intending to move forward in part 3, the key stakeholder discussions, in the next few weeks and months, just because now we're at a better place to hold those conversations. Next slide.
Yeah, so thank you, Shelby. That was a great explanation. And so, yeah, I just wanted to bring it back that, really this project is all about, just trying to ensure greater accountability, really with respect to services for First Nations children. And there's, lots of questions to unpack here that we will be looking at as we start to sort of think about what are the 3 or 4 options that we're going to be putting forward. So, who is it that this work we want to hold accountable with? I mean, it was requested by ISC that we undertake this work. So certainly at a first level, definitely looking at ISC. But would be a role of some sort with respect to whatever this function is, with respect to the provincial governments, because Jordan's principle and these human rights decisions say that they're equally responsible to provide these services. And how do the two interact? And, I mean, some of the anecdotal stuff that I've at least heard from my corner of the world is that, Jordan, the provincial government sort of has told people, like Jordan's principal navigators, basically, well, no, we don't have to provide any services. You've got that federal program around Jordan's principle, and that's not really how it's supposed to work, folks. So, I mean, there's these questions of accountability there. So there's looking at that question of provincial governments and potentially other actors who might be involved. As I said, agencies. So there's a question of how far does, for this particular mechanism, how far do we go with that? And then the question of who, as we've been trying to say in this presentation, it's not necessarily an ombuds. That's a sort of, a type of body that's hold governments accountable. But there can also be child advocates. You can also have tribunals. So we're looking at the pros and cons and what they, the different functions of these different sort of accountability bodies, what they do, and trying to see what will work best. But it's also part of hearing from the stakeholders too. We kind of get a picture of how it can work so we can go out and explain to people and then get back from them whether they think things are going to work or not. And yeah, and then with that, there's all these questions about how best to hold governments accountable, right? There's different ways to go about things. You can go with a big hammer and stick and sort of say, you're going to do this, and you can get court orders. That, there are other schools of thought that you can have sort of softer advocacy that happens through mediation and advice and sort of behind the scenes, perhaps. And, there's, so we're looking at all the research on that because it's a nuanced question. There's a lot to unpack. And there's even some schools of thought that say that, when sometimes it comes to government services, sometimes that softer hand, that sort of behind the scenes might get more accomplished. But maybe but we've also heard from Indigenous folks that you need kind of a hammer to get the government to do something. So we need to figure out ways of how can we get the ultimate sort of accountability, and still have sort of levers. And maybe there's ways to do that. So we're going into all of those issues. I don't know if you wanted to add to that, Shelby.
No, I think you did a good overview, and I'm going to touch on some more contextual things on a later slide. So.
All right, next slide. Yeah, the last piece I want to touch on as we're working through and thinking through these things is recognizing that whatever sort of options are going to be put forward are going to exist in already a framework of accountability. And this involves sort of looking, so there are already some bodies that hold, governments accountable in different ways. We've got the Canadian Human Rights Commission, and, the Caring Society decision is a great example of that. On the other hand, we have provincial commissions, and the Sumner-Pruden decision shows us that they're starting to have a role. So we already have those, and they provide sort of some hammers. Then we have the courts. The courts and haven't been as active in this area, but there's a possibility. On the provincial side, most provinces do have some form of like ombuds function, and some provinces have child advocates. On the federal side, I've kind of graded out, but there are ombuds functions, but none of them are with respect to First Nations issues. And obviously, we have also this the Moody bill with respect to a potential child advocate. But as we're thinking of the model, we're going to have to figure out how does what we're proposing interact with all of these different bodies, right, to achieve the optimal sort of level of support and accountability to support First Nations children. So yeah, it's a complicated picture that we have to look at. Over to you, Shelby.
Yeah, the next slide, please. So we just wanted to kind of give a brief overview and some key highlights from kind of the research we've been doing about accountability mechanisms. And so just to start, accountability mechanisms have had a role in addressing problems in the conduct of governments. For example, the first ombuds institutions were established to monitor and supervise the administration of government. In the beginning, most of these accountability mechanisms had general jurisdiction over all actions and activities of a government. But over the past few decades, there's been a substantial evolution in how accountability mechanisms are structured, the approaches used, their areas of oversight. And some of those evolutions include that the general mandates have actually expanded to include human rights protection and promotion abilities. There's also been specialized kind of accountability mechanisms established. And like Naomi has mentioned, the child advocates and the human rights commissions, they're kind of specialized in their area. The other thing is that there are many elements and considerations to consider with respect to accountability mechanisms. And for today's presentation, I will just highlight some initial elements and considerations just for everyone's maybe benefit or just information. So accountability mechanisms are often legislated, and this is to ensure their independence and make sure that they're able to do their work without interference. They also offer a flexible or more flexible process and more flexibility in how problems are resolved. These mechanisms are also typically have very strong investigation powers. And this is seen as a strength because it enables them to really get into the details of the problem and understand the problem and then to make recommendations to resolve them. As we've kind of discussed a little bit, accountability mechanisms typically rely on relationships and the power of persuasion over enforcement. This cooperative nature is seen as both a strength and a weakness. It's a strength because it gives an environment to reach kind of consensus decision making, working with each other to reach a solution instead of creating like forced, reluctant change. That being said, this is also seen as its negative because it can't force actions of reluctant people and to reluctant parties to take those actions to make the changes that are needed. That being said, many of the accountability mechanisms have enforcement abilities, but they're often just linked to their investigation powers. And that's where that strong investigation powers is seen in these mechanisms. And they're really able to get into those details, get all the information they need, and kind of provide the recommendations that are needed. I just want to highlight some of the advantages over these accountability mechanisms over court processes. These include that it's a quicker process. Court processes can often be very long. Caring Society is a perfect example. Look at how long it's taking to get these changes. So that's a pretty big advantage to these mechanisms. The other thing is they're more accessible due to the minimal costs associated with accessing them. They are often free, and they're kind of a public service institution in that regard. And then they also offer that flexibility in resolving problems in comparison to courts, where courts have their specific options for remedies or recommendations or resolving problems, where in these accountability mechanisms, you can really get flexible and try and work out different issues. I also just really want to highlight the widely held concerns over the lack of enforcement ability as it relates to implementing those recommendations and any action. As we know, it's hard to get people to act, and that enforcement piece really can help those reluctant parties to take the necessary action to resolve problems and make the changes we need to see. Next slide, please. All right, so this is our kind of final slide here, and it's just kind of talking about our next steps, the key stakeholder discussions. This is a really, really important piece. We need to understand from all the key stakeholders what the needs are. So we're kindly asking if anyone is interested in speaking with us with respect to accountability or providing feedback, if they could email me. My email's on the screen. I apologize that it's long. It's just my full name. It's unique, so that's why it's that way. And also, when you're contacting me, if you don't mind kind of providing just some background information about your interest or your role or your relationship with Jordan's Principle, and kind of what areas or topics you would be interested in participating in discussions or providing us information on. And I just want to thank everyone for giving us this opportunity to speak.
Thank you, Shelby.
Thank you so much. Just one more thing, Matthew. The reason why we're asking you to give us that information is not because we're nosy. It's because in putting together we're not going to be able to do one-on-one meetings with lots and lots of people, but what we can do is identify groups of people, right? And so we're asking you for that information to sort of identify your connection to Jordan's Principle or your interest, so that we can sort of arrange some stakeholder sessions where we can bring a group of people together. So that's why. And thank you very much for your time. I'll turn it back to you, Matthew.
Thank you, Naomi. Thank you, Shelby. A couple of questions. I was fascinated by the fact that you framed it all around accountability. Right, it's all framed around another accountability arm, right? Another way that populations would have to hold administrators, for example, accountable. I was curious about the distinctions made between advocacy and an ombudsman, only because I was thinking an advocate might not have anyone approach them with an issue, right? You as an advocate, you might just be watching and observing how things are unfolding, and then you would advocate. Whereas an ombudsman would receive complaints, right? And they would receive complaints. And I'm guessing the difference when Shelby, we were talking about tribunal versus ombudsman, the tribunal process is specific to human rights. If I'm guessing, would an ombudsman scope be beyond human rights complaints?
Typically, yes. It's the ombud's function was for generally just all actions of government. And originally, like you were talking about the original one in Sweden, it's more administrative, and it was looking at fighting the maladministration, right? And kind of checking governments in how they're proceeding in their actions. And implicitly that sometimes involved human rights issues, but over time, these institutions and these accountability mechanisms have kind of strengthened that human rights component and given explicit roles and responsibilities related to it. And again, that those roles and responsibilities can vary substantially. It can vary from promoting human rights to preventing and protection. And again, these accountability mechanisms can have different roles. They can take actions to litigate sometimes, or, you know, they just provide that monitoring oversight. So that's like, there's so much variety in all these different mechanisms.
So the next question is around the authority, because I'm thinking you're also talking about Bill C-92, which brings in another jurisdiction, right? Because if you think of Bill C-92 and the First Nations assuming jurisdiction and then becoming the government with regards to child and family. So do you see this advocate ombuds role holding federal, provincial, and First Nation governments accountable? So would they be independent of all three? Because I think there's an independent nature of being an advocate or an ombuds person. So do you see those three jurisdictions coming together to set up this office, to hold all those three structures together? So I guess I'm wondering around the scope of this thing. It's really, it could be huge. And then I guess the interaction with other advocates, right, was another question we had.
Yeah, and I mean, those are related, right? So that's why I sort of had that slide that showed like, this is not, you know, there are already pieces that are here, and we might see that some of them are really not working well. Like, what roles are currently provincial ombuds roles having in holding provinces accountable to providing services to First Nations? So, I mean, we could look at that, and maybe what you need is somebody who can put a federal ombud who can push on the provincial ombud, right? So that could be a potential role as opposed to completely, you know, ignoring that there's already some of this infrastructure there. Like, we want to work with it, not necessarily entirely replace it. I mean, so, you know, we're going to be conscious of that when we're sort of working through that. And there are sticky jurisdictional questions. I mean, first of all, the provinces have their jurisdiction to create their oversight and accountability, and the feds might not be as interested necessarily in telling the provinces exactly what to do through all of that. So it might be more of a liaising with other bodies at a provincial level as opposed to necessarily providing full oversight. And the First Nations one, I mean, that could get really huge, but I think that First Nations are sort of, as they're, asserting jurisdiction, starting to put their mind to it. And I believe that there are some groups that are starting to think about what their own accountability for their own governance system might look like. I mean, the ask for this came from ISK, right? And in the context is in the provision of services of Jordan's principle that ISK is primarily funding. We may look sort of what beyond that and what an accountability function could look like, but I don't know if like the full scope will include so as broad as to be an accountability mechanism over Indigenous governments acting in this area. Not at the outset, perhaps, but we will definitely be open to hearing from people's thoughts on that.
I'd be curious only because I was thinking about the accountability structures. You know, the existing accountability structures are focused a lot within community. You're talking about a new accountability structure or adding to an existing accountability structure. We do have elections in terms of our accountability to our chiefs and council accountabilities to us. But like, if they're going to act like government, should they not also have the structures that protect their citizens from their own actions, right? So I wouldn't want to only limit it to federal, provincial, if the government acting on behalf of the citizen is the First Nations government. You know what I mean? So I'm just thinking of the gap that might exist with regards to administrative complaints with regards to citizens to their own nation. So I'm thinking, the nation building component will also have to include some kind of accountability structure for the citizens within those nations. So I'm feeding off the conversation we've participated on C-92, right? The idea of creating nothing under Section 88, this own standalone jurisdiction. But with that, there should be perhaps this ombuds advocate. I'm thinking, it might be a function and be part of that governance structure. Before I go on to my own conversation, and I guess the liability. I don't know if there's something that you're looking at. There's a question here. What about the liability? I don't know what the liabilities might be. Are they the liabilities of the advocate, or so it would be? Okay, so maybe you know something more about that. Go ahead.
I'm assuming they're talking about liability and the actions of the accountability mechanism, and often there's provisions in the kind of the foundational, either legislated framework that kind of limits their liability in the actions and the investigations they're doing. So and the other, I guess, piece tied to that is these ombuds functions are often impartial as well. So they're acting in that impartial space. And the importance of that not being liable piece too is crucial, because it kind of feeds into the independence of the ombuds person and their ability to do their work thoroughly and fully.
Here's another question I have. I'm not sure I understand it all completely, but you guys are the contact expert. What judicial review and authority would they be responsible to take matters to? So does that mean would this go to the Federal Court of Appeal or not? Or would it go to the Canadian Human Rights Tribunal? Or would it go to another kind of tribunal? Are there other administrative tribunals other than human rights tribunals?
That first one's easier than the second one, so I'll jump in. But we have the specific claims tribunal.
Okay.
That's an example of one specific to Indigenous. But there's all kinds of different tribunals when you look at provinces and the federal government in terms of different types of disputes and stuff like that. So these are fairly common. I mean, it's all going to depend on what's in the legislation, right? The legislation is what dictates who you go to for what. So it's not like so much will they go to this group or that group, but us to look at, would it be better for them if there was a scenario where they could either push a complaint up to the Canadian Human Rights Tribunal, or would they go to the federal court? What would be the pros and cons of going one way as opposed to the other? And I think we're interested in looking at those questions, or they could even go to a superior court in the province. So we would want to weigh the pros and cons of all of those different options. If, and I think we are interested in looking at the sort of the hammer, but figuring out how that hammer works, maybe in relation to these other mechanisms like tribunal and the courts.
I'm wondering if this is part of your conversation. Maybe I'll blow it up in terms of expanding the scope, but I'm thinking about the idea that, Shelby, you're talking about, the non the yes, no, or the white, black, the court system, how you want to create a system that's built towards consensus or finding solutions. So I'm wondering if this might be a venue to start identifying structures that it could go to. You know what I mean? Not to create something that's Indigenous and then boom, it goes into the non-Indigenous world and decisions are being made. So I'm thinking about the scope of this. If you were to have an ombuds person and the complaints are coming to that ombuds person, you don't want it to be usurped by suddenly going back into the system in which you have issues and complaints with. So that independence is going to be something to explore, and its authority, where does it come from? How is it appointed? Because right now we have governors in council. What do they call it? The appointments in council by the cabinet. And that's usually always the go-to, right? Prime Minister and cabinet, they go and they appoint those people. Well, that would not be independent of the government, federal government. So what is the mechanism, for example, and maybe it's by jurisdiction, maybe it's by nation in terms of ombuds persons or advocates within those nations, because I guess respecting that authority and respecting that jurisdiction and respecting the citizens' ability to bring complaints around the administration within their own nation. Was that a question? I don't think it was a question. Maybe I just blow it up. Just saying, where is this all going and where does the authority come from? We wouldn't want it to suddenly find itself back with ISK, if you know what I mean. Does that make sense? I don't know. I don't get any reactions from anyone.
I'm nodding.
Okay, good. So just I want to thank you both, Shelby and Naomi, for joining us. Very interesting conversation. Obviously, the scope of this could be gigantic, or it can be very narrow. And I think, the options that you have, exploring, pushing the envelope. I know you're lawyers, you're trained as lawyers, and the lawyer thing have to do lawyer things. But if you could blow it up and become a super duper no jurisdiction lawyer and come up with how to solve this all, would be fantastic to look at those options, right? And have a conversation and then frame the conversation on that knowledge. So I wish you luck in your endeavors and continue the good work. And hopefully we'll see you along the line. Maybe I'll write down that note and get in contact with Shelby. Thank you very much.
Thank you, Matthew, so much. Thanks, everyone.
All right. With that, well, we have an important agenda item coming up next, which is a break. So let's take a quick break. Let's take a quick break. Let's take 10 minutes. Let's take 10 minutes. Let's come back at 10 minutes, 10 to the top of the hour, and reconvene our conversation. First Nations Consortium Service Coordination Research Project. See you soon, everybody. Welcome back, everyone. We're back from break. So welcome back to the AFN's virtual gathering on Jordan's Principle. We're coming to the end. We're kind of down the hill. It's almost like Hump Wednesday, but for conferences. But I think we're closer to Friday than we are to Wednesday. Our last topic item. We are joined by, who are we joined by? Barry Phillips and Carol Blair. Barry Phillips is the Executive Director, First Nations Health Consortium in Alberta. Carol Blair is the First Nation, also from the consortium in Alberta. And our anchor is always with us, making sure that we have, if there are any issues or concerns out there, Julien is joining us from ISK. Our topic. What is our topic today? Our topic is First Nations Health Consortium Service Coordination Research Project. So they're here to talk about a research project. With that, we have Barry with us, Carol's with us, Julien is ready to go. We have our PowerPoint presentation up. Mr. Phillips, the floor is yours.
Thank you. We're going to let Julian start off with our points here.
Okay, Julien, it's all yours.
Of course, I was muted. No, thank you for the opportunity to discuss this really exciting project that the consortium is leading. We've identified that we need to learn more about what the reality of service coordinators is. So I need to just a second. I think to start, the question of the title of this project is it's important to reframe it a little bit. It's not exactly a research project. It's data collection. It's an environmental scan. It's less about getting to a final publishable paper. It's not about that at all. And actually, it's about giving service coordinators the opportunities to be heard through different mechanisms, and for us to learn about the realities of what it means to be a service coordinators and supporting families accessing Jordan's Principle. And the First Nation Health Consortium, Barry and his team, have lots of experience in service coordination and in discussing with the Assembly of First Nation and in other partners. They have accepted to work on this important initiative to kind of have a better sense of the lay of the land as to what are people doing and how can we learn more about this and take this into account moving forward. So on next slide. Of course, this is again a project that it's important to remember and honor the memory of Jordan River Anderson. We've heard about this young boy throughout the sessions over the last few days. And I think that this is also something that we want to honor in doing this work the right way by giving voices to those who are providing support and services to the children and families who have needs in communities and elsewhere. Next slide. The outline of the presentation today is to give a sense of the purpose and the goal of the project, what the First Nation Consortium's role is, and to raise awareness on the project plan, the progress, and how all of you participants to this gathering may have an opportunity to participate and to contribute with your own learning and experience. And I think here I'm going to pass it over back to Barry and Carol.
Okay, next slide, please. So, as Julian said, the purpose here was to, collect information so that we can share it amongst ourselves and learn from each other. The input that we receive will be brought together and Carol will explain the process later here, and we'll share this information back out with everybody. Next slide, please. You know, by working together, that's how we're going to be able to gain understanding of the issues out there, and be able to learn from each other and share this information, and perhaps affect you know, the way that this moves forward. We want to take a look at, you know, what is working, what isn't working, what kind of recommendations can we make moving forward. Next slide, please. So first of all, why First Nation Health Consortium, and why are we involved? The Alberta First Nation Health Consortium consists of 4 health partner organizations in Alberta: the Sisika Health Services, Muskogee Health Services, Big Stone Health Commission, and Kitaskinou Health Services. That represents 11 First Nations with a combined population of over 40,000 members. We have representation from all 3 treaty areas. Following our process in Alberta, we operate under a co-management agreement between the federal government, ISK department, and the Assembly of Treaty Chiefs. The consortium was awarded the contract to deliver the enhanced services coordination for Jordan's Principle for all Alberta First Nations, and we work with both on and off reserve members. As you heard yesterday from one of our managers, we also provide payment options for clients, families, and service providers. Our regional approach to service delivery offers us the advantage of economy of scale and diversity of skills and experience amongst our service coordinators. It also provides us the opportunity to develop a very robust data collection system that provides us with analysis of needs and opportunity for our Alberta leadership to make recommendations on how best to improve service delivery. Our annual reports, by the way, are available on our website, which is abfnhc.com. Our representatives that attended the last gathering came back and said how important it was to them that they were able to meet their counterparts from across the country and share ideas and knowledge learned from all of you. So we're equally excited then to be part of this national survey, where we can learn from each of you insights that you share with us, and where we can commit to bring these ideas and information together for all of us to better understand what information we do have and how best we can use it to advance the work that we all do to improve the lives of children and their families. I'll now turn this over to Carol Blair, our survey coordinator, who has worked with us since day one of our organization and whose team will be leading the survey process. Thanks. Carol, next slide, please.
Thank you very much, Barry, and hello, everyone. I'm delighted to have this opportunity to talk to you further about the project, and I will ask our convener if you could go to the next slide, please. I have 2 slides I'm going to discuss with you today, and that will conclude our presentation before we go to the live question and answer session. So the first slide is to give you a sense of the overview of the project and the steps that we're following through on. The second slide, I'll go into a bit more detail about the methodologies, where we hope all of you will participate and provide as much input as you can to this project. As you look at the project plan, you'll see it's pretty standard for any project work plan. There are 4 key phases. The first phase being the project launch itself. That happened last fall. There were 3 major activities required to complete that phase. The first one was to confirm the work plan. Of course, it took some time to be sure that we had an agreed upon scope of work and target for the work. So that occurred, obviously. The next step then was to make sure you were all informed that this work was taking place. So those who were on an identified contact list received emails, received a letter via email, I should say, signed by both Julian and Barry with respect to the project. And we hope that whetted your appetite to be involved. The last piece that was very important in the project launch was with respect to the service coordination and the service coordination organization contact listing. I think all of us who work in these organizations know that maintaining a contact list of specific individuals and specific roles and positions is very challenging. So our first task was to take the list that Indigenous Services Canada had with respect to individuals so identified and to make contact with them to update their information or just generally update the list in terms of individuals who were represented on that list. The process we used was one of making phone calls to all the individuals on that list. Hopefully, and in some cases, we were able to make contact with people, but often the calls resulted in leaving messages. When that occurred, we followed up with emails to those individuals, providing additional details with requests for updating their contact information. And as you can expect, some of those emails bounced back. So that was notice to us that those individuals were no longer involved in those roles, at least as identified on the list. So once the task was completed, we were left with a list of about 170 names. So they could be individual names, they could be organizational names. And I want to pause for a moment here to say that that task was completed in December. We're well aware that there are likely to be new individuals who have assumed those roles, perhaps even organizational identities. And we invite you, if you think you're in that circumstance, to just make your information known. You can either send an email to Julian or you can send an email to me. And that would be carol@abfnhc.com. And perhaps our convener can note that information in the chat box. But we for sure want to be sure, that's a bit of a redundancy, that we've made contact with all of those who are in frontline positions, who are the service coordinators or functioning as a service coordination organization. So then, having done that, our next step was to get into the actual data collection phase. And again, I'm confident all of you are well aware of the amount of work that goes in to developing a variety of methodologies and then testing them. So we've spent considerable time ensuring that we have the right questions with respect to focus groups and with respect to the survey. We've been fortunate to pre-test the survey twice now, and thanks to the service coordinators who work with the consortium, who have given us their time and provided excellent feedback on those questions. So we're confident that we now have the survey in final stage, in fact, soon to be released. The focus groups, the same situation in terms of ensuring that we have the correct questions for the focus groups. And again, testing occurred with our protocol and our methodology for the focus groups so that, again, we could fine-tune both the questions and both the process. The last methodology is what we're referring to as targeted telephone interviews. So there are really two target audiences. So there are those who are the frontline workers, the people who are the link and the connectors to the First Nations families and their children in providing services or arranging for services that may be funded through Jordan's Principle. So those are the people, I guess we could call them as the spot where the rubber hits the road. So that's our key target. But we also have another target with the interviews, whereby we want to talk to individuals in senior leadership positions who have a strategic, perhaps a policy role when it comes to Jordan's Principle, to ensure we also get that level of perspective into the project. So those are the main methodology. So then there are 3 of them. They're all being provided and being translated into French language so we can reach all our population across Canada. The 3rd step then, once it goes live, those products go live, and we're expecting that next week. Of course, then will be the analysis in terms of what have we learned about what's working, what's not working, what are the challenges, what are the recommendations. And from there, then putting all of that information into a report. So the target for the final report is June 21st, and we're hoping that we'll be able to meet that just fine. I'll now ask to move to the next slide, please. So the next slide will give some details on this slide, give some details on the 3 methodologies that we're engaged in. Let me start by giving you an overview of the process. So those of you who are currently listed on the contact list will receive an email invitation. That email invitation will have 2 parts to it. The first part will be to register for a focus group. And of course, there'll be a registration button that you hit, and then click on to the registration platform, where you'll be given a choice of the region you represent and dates for focus groups for that region. The second part of that invitation will be the survey itself. So the survey, there will be a link there. And of course, as you know, you just click onto the link and you'll be taken to the survey. For the regional focus groups, as you can see, they are geographically organized by region, and those are the regional boundaries as set by Indigenous Services Canada. We are planning for up to 25 virtual focus groups based on the number of individuals we know now. And let me reiterate that we are prepared to do more focus groups if required, if there are more individuals than we currently have on the contact list. We are setting the focus groups at 6 per person. We have learned through Zoom best practices that size of group on a virtual platform allows for the best type of interaction and conversation around the various topics. So that is our goal there. Now, one of the cautions in putting dates in PowerPoint slides that are done a little ahead of time is that these dates now are being pushed back by 1 week. So next week, we plan to have the invitations out to everyone again on the list. We did a test of our registration system, and we just need to tweak a few things in it. And we're also doing the final translation of the survey. So we're almost there. So the second methodology then, of course, is the online survey. It consists of 23 questions. Most of them are closed-ended questions. So respondents will be faced with a checklist, and they simply check off those items that apply that are of course, pertinent to that particular question. We have open-ended questions as well. And I want to stress that those are primarily at the end of the survey. So please carry on to the end of the survey, because the open-ended questions address what you view as working well, what you see as the successes, the major benefits to First Nations families and their children, The second open-ended question deals with challenges, and the third one deals with what your recommendations would be going forward. So those are the critical questions. Our pre-testing has demonstrated we can do the surveys can be completed in about 30 minutes. I think all of us appreciate, though, that depends on how verbose an individual might be when it comes to the open-ended questions. But we encourage that because we really want to collect a rich data set for this project. We're intending to allow about 3 weeks for completion of the survey, and we're hoping people will, of course, do it as soon as possible, but we're all well aware of the many demands on your time, so we want to allow sufficient time for that. And as well, the survey is one that you probably all have had some experience with this, where you can save it and then go back to a later time, do some and save it before you complete it. And the last methodology, of course, is around the targeted telephone interviews. As I've already mentioned, we've planned for up to 20 interviews to be conducted. And those are scheduled. Those, again, the schedule moved back a bit. We're anticipating those likely mid-April because we really are interested in completing some focus groups before we enter into the interviews so that we have a sense of some particular perspectives from the front line that we might want to further explore with the senior management team, or maybe it's a management team or senior in leadership individuals. So those are the main details around the project plan, around the methodologies we've developed. So I now turn it back to our moderator for the live Q&A.
Thank you, Carol. Thank you, Julien. Thank you, Barry. I guess my first question is that has the project identified any data gaps so far in terms of what you're aspiring to and perhaps the information that might be out there?
We, as Carol said, we've tested the survey questions and that. And when you say, are there any data gaps? Well, the reality is that we have to keep the survey at a workable amount of time for the demand that we're asking people to participate in, and knowing under these conditions that everybody is extremely busy. We've tried to do the best job we can in making sure that we've covered everything that we think is priority, and that, but then that allows the open-end questions, I guess, for people to participate, that are participating, to provide us other information that they think perhaps we should have asked, or we should know, or this, because right now the biggest trick is that we really don't know what's available out there for data. And that's part of the reason why we're doing the survey is to find out, what kind of data is out there, what kind of data is being used, what kind of data is important, what kind of data would people like to see, so that we can all grow from this experience.
So that's part of your questions, I guess, is what information would be important to you. So it's not necessarily measuring what they're doing. It's really a learning exercise on getting a sense of what's happening out there, and then, identifying data needs. I guess the question I have are, what kind of data systems can First Nations develop to implement and support their data needs? Is that something that you'll be exploring? Then maybe perhaps the outcomes will be something that First Nations can use to develop their system. So I'm just wondering about that. Go ahead, Carol.
Okay, I was just going to comment. The survey has a number of questions that deal with the data that's currently being collected, or that people view needs to be collected and is not being collected, and why that's not happening. So we have a list in terms of the types of data that people are actually collecting, how often they collect it, who that data is reported to, how that data is used, and as I said, what data is not collected and how it could be collected. One of the questions is also where data is being collected is the type of platform that's currently being used. So
that speaks a little bit to the infrastructure needs, or the infrastructure. Is that the right? But the physical.
I think we heard yesterday when Julia was on a panel talking about the payment systems and that if I'm correct in what I heard, and what I think I heard there was 3 of the 4 were collecting data, but there was no consistent program. So each had developed their own, and the 4th one was developing one. So it was actually looking for what others were doing. So actually I've asked Julia to reach out to them and say, okay, well, we're more than prepared to provide you what we're doing, and if it's of some value, then we're more than prepared to help them with that system. But I think that was one of the things that came out of yesterday's discussion was maybe a lot of us collect data, but maybe not consistently the same data. And so how do we get it together?
I don't know, Julian, want to add anything, or Carol?
Well, yeah, I'd like to definitely on the question of gaps. This is the intention behind this project, is a bit getting at, like, we don't know what we don't know. So we want to have opportunities to fill in those gaps. Jordan's Principle is a request-driven initiative where people submit requests, individual or group. And so we have information about what does come to us. We have information about the types of requests that are being approved, the type of funding that's being approved. But all of the texture of the richness that we've learned from participants in some of the panel around their ability to do more than just go from a request to an approval to a product, but to help the families navigate the system, sometimes to help them access services that are not necessarily Jordan's Principle. I've learned a lot in working with the consortium that's a huge component of their work, which is making connections with different stakeholders in the system. And so this will also allow us to have a much richer understanding of the breadth of diversity of the work in the service coordination organization. And if it's not necessarily quantitative data, it is also opening the door to the qualitative data around how is it being implemented, how are they working together with other services, the provinces and territories. And so we're really wanting to have a more fulsome story about how service coordination in some cases plays a role to support case management, plays a role in terms of system navigation, and then how can we use the data that we do have to kind of build and complement each of those different types of information to feed our thinking going forward.
So it's really focusing on that coordination of services, right? It's looking at how organizations are coordinating those services, those who are in the business of coordination. So are you comparing it to those who are not in coordination services? I don't know if there's a comparison in this research project, or it's just really getting to understand the coordinated services.
This speaks a little bit to the difference between the two kind of contribution agreement streams of funding. We do a lot of service coordination, which is like the consortium. We've heard from Independent First Nation and yesterday the Union of Nova Scotia Mi'kmaq. So the difference between service coordination and service delivery is one that for some communities, they're playing a role in both. For others, their roles and responsibilities are more divided. But it all comes down to how do we support the families in navigating the service? And then once the service is approved or there's a process to obtain a service, who's helping the community, who's helping the family deliver the service? So in some cases, the communities are delivering the services themselves. They're reporting to their contribution agreement reporting, and we have some information on that. So we're trying to kind of bridge those two pieces of service coordination and service delivery. But the service delivery component is not as scoped into this project because we really wanted to focus in on the service coordinator component, which is one that we're hearing a lot from participants and partners, that it is part of the solution going forward.
The next question I have here is how are Indigenous methodologies or worldviews integrated into the research project? I'll go to our audience and send us more difficult questions.
Yeah.
I don't know who wants to tackle that.
Yeah, I'm not sure, other than to say that we are being as sensitive as we possibly can to the cultural component of the survey, how we're asking the questions, how we're dealing with the focus groups. I'm not entirely certain that's the response, though, that the questioner may be looking for.
I guess it's usually a lot of times it's a broad scope, right? It's looking at everything that might influence those things. So I guess it's the idea of the worldview being broader.
Mm-hmm. And if I could also add, it's also why we wanted to work closely with a First Nation-led organization, so that the questions, the testing is done by the people who are doing the work, for the people who are doing the work. It is not a research project that was done separate from the rest of the Jordan's Principle system. Barry and the team at the First Nation of Consortium, as Carol mentioned, have used themselves to go through the material, have used themselves to see how it does make sense in their context, in their work, how it can land for those who are involved in service coordination. So the important piece that we're hoping in through this work is that it is driven by First Nation organizations involved in service coordination. And the result of this is going to be to the collective benefit of the system, and not for the purposes of a research or an academic purpose, but to truly have lessons learned and to feed it back into the system, so that it can be used and useful for everybody.
And I think when you get a chance to see the survey, both the questions and the selection, in some parts where you select answers, and in other parts where it's open for you to provide information, that the answers we get are going to answer the question that you just asked. And is it responsive? Is it understanding and this of the differences? And so it was an interesting question, because I think that's part of what it is that we're looking at in the survey is this taking into consideration those issues that the question you just asked are trying to address.
Thank you, Mayor. I have another question here. Will you collect data on the different costs of services so that a baseline of the costs of various types of services can be established? I guess that's why I'm kind of thinking collective versus individual community service. I'm wondering if there's a cost difference or if you're doing anything around costs.
Yeah, we're not really addressing the cost issue, but it was interesting because yesterday, again, in that session that Julia was part of there, I did note, I think it was the Nova Scotia group that had an innovative way of tendering out work and then establishing costs to make sure that fair and equitable treatment was given was being given to everybody, and that the solutions that were going to be required to meet the needs of the child and family were in fact, available and not necessarily denied or altered or watered down or whatever because of costs. But we're not, in the survey, we're not actually addressing cost issues.
Will ISC pay for a data clerk on a short-term basis if a First Nation wants to start a database, and would they fund the creation of a database specific to community needs?
That's definitely a question that we would have to go through the specific. I would invite the person who asked the question to get into contact with their regional office or with me and my team to help you navigate that question. Definitely, we've heard how important the quality of the data and the capacity to gather data, to collect it, and to use it is critical to both innovation and continuous improvement, and knowing what we're doing and telling our story. So I would want to say that there are possibilities depending on what organizations you're with, what is the role and responsibilities that you've taken on through contribution agreement for Jordan's Principle or other program, but that is part of what we're in the business to do. It's having good data about the services and products that children receive.
And another question I have here is, are you collecting any data around traditional medicines and supports?
I think that I'm hearing a lot of those questions having a kind of specific lens of either categories of products or services. And what we're doing here is, I think, trying to have a better understanding of service coordination writ large and how it's playing a part in making those connections and in helping families navigate the different options that may be open to them to meet the needs of their children. So in the context of these questions, traditional healing and support, I think it's part of knowing what service coordinators refer families to, and is that part of what they're doing right now, trying to give choices to families to address this culturing component. But we're not necessarily looking at gathering data on that in itself, nor are we looking at education or other kind of specific categories of products and services, but it's going to help us learn about where our families referred to or who are they working with through their work with service coordinators.
Mr. Julien, go ahead, Carol.
Yes, I wanted to comment. In the survey, we do have questions on the types of services and the types of products being requested through Jordan's Principle. So we've identified a list of services and products that we know are being provided, but we've also added an other category. So if we've missed something on that list, we invite people to note those other traditional medicines, traditional therapies. Yes, for sure. So it would be collected via that mechanism.
I guess I'm wondering around, because yesterday's conversation, a lot of the value added, right? You know, you have the product, but then you go into the home and you make sure it works and you test it out. And so that value added thing, it's not necessarily traditional, but maybe it's more holistic. Maybe, you know, that kind of worldview where it's not just, well, your product arrived, come pick it up. You know,
yeah,
they actually follow up and they engage. And I guess those soft supports are not necessarily easy to measure. And also the things around trust, you know, are not easy to measure. The establishment of trust, the path that leads you to a place to actually go into a person's home or as a service delivery provider. I guess it's those soft questions around love, compassion, bravery, you know, those kinds of worldview or indigenous worldview questions that sometimes people want to see, right? That, like, we put a lot of effort in building this relationship and building the love and building the trust, but it doesn't show up anywhere on any report. It's not measured anywhere. It's not quantified or qualified in terms of that's the value added, right? So I guess that's the challenge I always find when you're doing these kinds of research projects, is those soft supports. And I'm wondering, are there strategies to try to get that out? And is it the long questions, the one where everyone can write in the long answers?
Well, I appreciate the point you're making, because it's absolutely critical in terms of being a successful service coordinator and meeting the needs of families. I think we all know that foundational base of trust and love and support and caring. The survey will allow for that with respect to the question we asked about major benefits. And there may be other avenues. We at one point did have a question about people sharing stories where their service had had a significant impact on a family situation, on a child's situation. We realized that could pose some complications in terms of permission for service coordinators to provide that information or upload it as part of the survey. So we actually ended up removing that question. But I'm hoping that people will identify that type of thing when they do talk about the benefits. What are the experiences that families and children have had? And Barry, you may wish to comment in terms of the work that you've done where families, in fact, have shared their stories with service coordinators, and it's very impressive.
Yeah, I mentioned in my comments that our annual report is on our website, and you might like to take a look at that, because within the annual report we have shared some stories, and I certainly understand the comment that led into this part of the conversation, in that we've all sat in that cabin and drank tea with the Kokum, and it does take time to build trust with people, and it does take the work of the service coordinator to truly understand, what the circumstances are for that family, and understand. I find some of my staff come back and, after some interviews, and you become emotionally attached sometimes to what's happening within that family. And that has to become part and parcel of the way that they frame that application too, and on how is it going to best meet all, the needs of the family, understanding the conditions in which they live, understand the conditions that are not just affecting that particular child, but the family as a whole. And so our staff tries to make that part and parcel of the way that they frame their application, and but it's, as Carol said, it was hard for us to try and figure out, okay, how do we ask and gather that kind of information, knowing that it's important, but under all of the privacy rules and this type of thing, it makes it does make some questions very difficult to ask and record.
I have another question here. There's a need for building First Nations-led database systems to address the needs of First Nations. What kind of data systems can First Nations develop and implement to support their own data needs? And I guess it was also maybe an extension to that question, not only their own data needs, but as Barry was saying, everyone's data needs. What can we learn about collectively? So I guess the question here is do you have any insight on perhaps data systems that would be beneficial to communities.
Well, I understand again from yesterday's comments that were made was that some people like us have developed their own data systems. Some people have modified, maybe boxed data systems, and some people were still at pen and paper or Excel spreadsheets. Well, everybody that's worked for me has heard for so long the phrase data is king. And so we have to find ways to be able to work together to collectively put together data systems. And that's why I said earlier, we have a system, we developed that system, we've spent a lot of time working and modifying that system, and that anybody that's interested in looking at the development of their data systems, we're more than prepared to share what we have for a system, and if it's a benefit to them, we'll make it available to them.
We'll need the answers too, Barry.
Pardon me?
We'll need the answers too.
Yeah.
Well, I have another question here. How will this research project inform systemic improvements to fill service gaps that are identified?
And that does come back to the conversation we had with Valerie at the beginning, which is how do we make the systemic improvement to both Jordan's principle and how we're implementing Jordan's principle as per the orders, and also the other programs and services that are important for First Nation children and youth. So definitely this is going to come and be part of the thinking as we're developing the longer term approach, as we're going to be working with partners nationally and regionally to mobilize the different players to contribute to a systems response, to contribute to better ways of accessing services and products. In some cases, continuing through Jordan's principle, and in others, it might be using the result of this research of this project to have a way of innovating something. We might have some insight coming out of this and saying, well, maybe adding this component to service coordination in this region will be able to come in and address this many needs under this category. So it's a difficult answer to provide in terms of in some cases knowledge and data. We need to be open to learning from what we're gonna see, and there might be things that we're not necessarily intending to find that will be main conclusion that we'll be drawing from the process. But the intention is for this to be another part of the puzzle, for us to improve the system, for us to improve the implementation of Jordan's principle, and we hear directly from service coordination and those in the front line as to what's that path to continue to make those improvements from their perspective.
Are there any other projects you're thinking about, or like I'm thinking, this is the first kind of a national effort in terms of trying to find out what's going on? Are there other research initiatives that people are thinking about, or that's in the conversation in terms of finding out what's happening out there? Or as you said, this is one, the service coordination type of research, but I'm just wondering if there are other, like, is there evaluations coming? Is there other research projects that the department's thinking about undertaking?
Yeah, in the last few years, there have been case studies that were done, I think, on the Choose Life and on the model My Child, My Heart that we heard from Gwen a few days ago, and those are available on the department website. There's been some internal evaluation, and as any other government initiative, We are going to be subject to audit and evaluation, and that's great. We're here to learn from those processes. So the only other piece that I want to add is we're working with the First Nation Information Governance Center to do a project on data for children, and that's also something that's it's work in progress. We've heard from them at the last Jordan's Principal Operations Committee. They're going to come back and continue updating us on the progress they're doing. But the work with the FNIGC is more on the quantitative kind of survey approach to outcomes related to children. I'm not right now describing it as eloquently as our partners from the FNIGC would be able to do. But there's also this part of the work and in gathering more data and working with the FNIGC on a research project.
How often is the audit and evaluation? How often does that happen? Is that like a full 3 years, 5 years, or is it tied to any kind of funding envelope? I don't know how it works.
That's a good question. I think usually, like for a regular program, I think it's closer to a 5-year cycle. In this case, we've been in existence for about that period of time. So it might be a little bit different given our how we're driven by the CHRT orders, but definitely we're also wanting to increase our ability to do our own internal controls and to have a better sense of how to do performance assessment and evaluation to understand the outcomes better. But the exact cycle for programs and programs evaluation, I think varies somewhat, but that's definitely something that I believe is going to be on the horizon for Jordan's Principle over the next few years.
See, so maybe this is a question for Barry and Carol. Are there something that you were looking forward to in terms of outcomes? Like a data or some story that you're looking for, you're anticipating or hoping to see, or I guess is there a story you're hoping to be able to tell?
I guess we have no preconceived ideas about what the result is going to be from the answers that we're to the questions that we're asking. We're really out there wanting to learn what we don't know, and I think what will come from the results of this process will lay out questions and issues and suggestions perhaps on how we might move forward and pull together what's needed, because I think that the process is changing so fast. The ground that we all work on is changing so quickly that I think the real goal here is I want to go back to that meeting, that last gathering meeting, and the reaction that my staff had when they came back from there saying, was that ever nice to be able to meet our counterparts from across the country, to learn that, one, we have a lot of similar issues, but two, we have different issues and therefore different ideas. And I would hope that what's going to stem from here is that same thing, is that we're going to get information in that's going to lead to what next can we do to all get and be better.
That's a great aspirational statement. I mean, that's very well put, Barry. How about you, Carol?
the first thing that came to mind when you said that for me is affirmation that Jordan's death is not in vain, that in fact it is generating a really positive movement across this country in improving the lives of First Nations children and their families. And I would hope that the results indicate the positive impact that is already happening, and also the steps that need to be taken to keep furthering that need for improving their life situations. For me, it's part of the whole reconciliation process, and I would hope ultimately that these results will feed into results of probably many other pieces of work being done and advocacy efforts, et cetera, all of those things to make Jordan's principle just a very strong foundation in this country.
Thank you, Carol. I should have asked this question to start the conversation.
I agree with what Barry and Carol just shared, and I think what we want is a reflection of the diversity of experience here. We want people to share their experience as they're going through it. And we know that on different things in different places, they're going to be positive or negative. And we just want people to share their truth, the way they've seen this play out. And clearly, if we're asking people from yesterday's panel who are doing a lot of innovative work, they're going to be able to speak about how great some of these things have allowed services for children and family. But earlier today, we've also heard from Marcel that he's having a hard time finding successes as it relates to aging out. So those are part of the diversity of experience and things that are going well on some aspects of the urgent principle, things that are persistence challenges and obstacles in others. And we just want to give that space, that opportunity for people to be able to share it as they're living it.
You make me think about that whole idea, that whole, the lack of a good story or good understanding of what happens with the children when they age the majority. Is that part of the conversation? Or is that part of the questions you're asking in terms of what happens when kids become 19 or 18? I don't know if is that part of the question?
Yes, there is a question to that effect.
Okay, perfect. Well, there you go. One of the things we were definitely looking for is to really quantify or qualify that's happening out there, and then to see where the gaps are. We had the two other sectors within the department here in terms of what they're doing. I guess it might inform that. And I'm also thinking about Louise and her engagement out there talking about assisted living programs. There'll be lots of things happening out there. Lots of questions. So hopefully everyone out there is preparing their answers.
Yeah.
And then I guess as I wrap up, what I'm going to say is advocate on your behalf. Be ready for Carol. Be ready for Barry to give you a call or that email or that questionnaire coming to your offices soon. We encourage you to sit down, relax, and articulate everything on the long answer questions. Right? Just start to everything that comes to mind. Just put it in there and breeze through the ones that are multiple choice. Yes, 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 no, yes, no, yes. And then spend some time on those long questions. Carol will definitely appreciate the whole view.
Absolutely.
So thank you very much for your presentations. We wish you well on your activities in terms of your research. And we're looking for the stories that'll benefit us all as an outcome. So miigwech, and do take care. And we'll hopefully see you somewhere down the future.
Thank you. Thank you very much.
Very much. Yeah.
All right. Well, with that, we got nothing else to talk about. Well, I'm sure we got plenty to talk about, but we have no time. We have 10 more minutes, and then the whole building shuts down. I'm kidding. But we probably have other things to do. That was a crazy day. That was a fantastic day. We had Marie Frawley-Henry from Assembly of First Nation and her big panel there of Dominique Marcel. And we had Julian, who was always there, making sure that we have that asset or that availability to questions or issues or clarifications we want from the department. I want to thank Julian for being here. throughout the 3 days, and bringing even members from the department to make sure that if we had questions, they could be answered. All of our guests, of course, I think we do make a donation on their behalf to the Jordan's Principal Scholarship. I didn't mention that today. So all our presenters on their behalf, in their name, will be provided with a gift to the Jordan's Principal Foundation or Scholarship Fund. Naomi and Shelby, they have a lot of work ahead of them. So it's going to be a lot of feedback. They're going to be seeking your input, much like our last presenters in terms of Barry, Carol, and their work that's being done out of Alberta. So it's going to be a lot of engaging with you. How do we make this thing better? How do we do things better? How are we more responsive? I mean, we had also, thinking, Dominic made me think about, our ASL translation here. I mean, thank you very much for the, what's fantastic about having ASL interpretation is that I don't have to have facial expressions. They provide them for me. See? Fantastic that way. So, I mean, that spoke to me about in terms of access. If we are engaged in a conversation about supporting children with special needs or individual needs or specific needs, and how do we engage those children around how do we do it better? So, I mean, that's a good conversation. And I'm glad Dominic joined us to actually start that conversation, and hopefully it continues. It was a busy 3 days. We heard lots. I don't want to go through the whole thing because then you can go to the AFN recording and you can get the whole thing. Oh, wait. Am I freezing? If I stand still, does it seem like I'm freezing? It's playing games with the technicians out there. If I stand still, don't make any noise, they think I'm on mute or I'm frozen, but it seems to be working, so I'm okay. With that, I want to thank everyone who participated and assisted with this gathering. The AFN staff putting together the questions, putting together the panels that they felt would be of importance to you out there, and hopefully you found the information very important and very relevant, and hopefully it assisted you in terms of the work that you do every day, and for which we are very thankful. I'm also I want to thank, interpretation. We have French and English interpretation also available to us. I want to thank my team here who provides me with all the annotated agenda and all the materials I need to kind of look silly, but that's okay. I will look it over. And we also have, I understand our elder is not able to join us, and I didn't mention that, but I know the regional chief, Kevin Hart, will join us to say a few closing comments and perhaps even close our session. So I'm waiting for him to arrive, and once he arrives, we'll go to the regional chief to close our session. There's a lot of people behind the background. We have Encore who's there, who's assisting us in terms of bringing us on stage, bringing us off stage, doing all the technical things we need to do. We have the ASL translation, which was fantastic, which was new for me, which I loved. And hopefully we had more participation because of it. We had about 1,300 people participating in our session, at least yesterday. Maybe we got to 1,500 today because it was, building. And everyone told a friend who told a friend, and then they all joined us. So they're probably 1,500 now, or 15,000. With the 15,000. All right. I think I thanked everybody, AFN staff, the staff here at Untitled Chapter, the staff at Encore. I thank everyone who helped us together. I want to thank Ed, and hopefully he's well on his way to Moose Factory for his medical appointment. Don't forget that link at the bottom of your screen takes you to all the documentation that's available to you. Don't forget that the afn.ca website, there will be all the presentations and all the recordings from today's session, a 3-day session, will be available to you. All the questions that perhaps I did not get the chance to get to or ask, they will be followed up on. So all the questions, all the comments that you have provided will be followed up on. The conversation obviously does not end here. The conversation continues. I'm looking for our regional chief to come on stage to close our session. I have 5 minutes to kill and have nothing to do. So I'm looking through my ASL translator. I'm getting word the regional chief's right, so I was looking to our ASL translator to see if she had any agenda items she would want me to bring to the forefront before the regional chief arrived. Nope, seeing none. Let's invite the regional chief up to the floor to provide some closing comments and even to close our session. So regional chief, are you close by? Hey, regional chief, how are you?
Good afternoon. How you doing, Matt?
I'm well, thank you. I'm well. You're looking well. Everything okay? Everything's still, are you still raining over there?
Well, actually, you know what? It was funny. This morning it was storming and then cold. Now it's clear and sunny again. So go figure.
Wait another 15, it'll change again.
Yeah, for sure. Tomorrow we'll have another foot of snow on the ground here. You know how it is, Manitoba weather.
That's for sure. So welcome. Thank you for joining us, Regional Chief. Our elder wasn't able to join. I hear you were willing to step in and close our session, perhaps some closing remarks and close our session. So with that, the stage is yours, and upon the end of your closing, we'll stand adjourned. So Gigwabman and Minoa.
All right. Well, I won't take long, everybody. First off, I want to thank all the organizers and the staff. I want to thank you, Matt, for, your endless work, and also the subject. You carried us well over the past 3 days here. I want to thank you and the staff. I want to thank Stephanie and the staff and the team at the Assembly. I want to thank all our guests, all our presenters, all our keynote speakers and such that provided such valuable input, brought knowledgeable advice, brought concerns as well too that is needed at the First Nation level and such. And my heart goes out to all the frontline workers, all the Jordan's principal workers and such out there that are doing all this tireless work, and especially during this pandemic time. We've ensured that the needs of our children are being met during this pandemic time through Jordan's principle, and lift people to thank that we've been able to utilize Jordan's principle. So, my hats off are to the teams, to the leadership from the respected First Nations, including, our urban areas, such and too, we have our leadership there serving First Nation children. But, in closing, and when I give thanks to the Creator, I want everybody to, think of Jordan River Anderson, think of his family, think of the community of Norway House Cree Nation. Keep the leadership of Norway House Cree Nation in your thoughts and prayers. But most importantly, right now, during this pandemic, many First Nations are still being forced to deal with COVID-19 with high cases right now in many regions across this country. So let's keep those nations in our thoughts and prayers, and the people that have been affected by this pandemic. And that I'm going to start my prayer now. So thank you, Creator, for bringing us together over the last 3 days. I ask you to bring blessings and to lift up each and every one of the participants that came online, each and every one of the facilitators, the organizers, the people in the background, keeping us on virtually, for the team at the Assembly of First Nations, for everyone out there, and especially all the First Nation children that we're trying to find justice for, and for the ones that we continue to fight each and every day. We ask you, Creator, to give us the strength and guidance. And we thank you for the spirit of Jordan River Anderson, and that you guide us through the spirit of our little brother to provide us with that guidance to bring justice for all First Nation children out there, so that they find all the necessary needs, so that they can live at home with the proper resources in place for, our special needs children that are there. And that we ask you, Creator, to bring us together again and to bless our home fires. And with that, I'll lower the fires. I'll bid everybody, like usual, safe travels. Make sure be safe. Hi. Thank you, Creator. Hi.
Miigwech, Regional Chief. Take care.
All right, take care.